Clerk, call the roll.
You have a quorum, Mr. Chair.
Thank you. Okay, at the request of the patron, entertain a motion to strike Senate Bill 697. Been moved and seconded that bill be stricken. Clerk, open the rolls.
Nine ayes, 0 nays.
Okay, that bill is stricken from the calendar. I got a request on Senate Bill 897, Senator Peterson, that bill be carried over for the year. Is there a motion on that? Been moved and seconded that Senate Bill 897 be carried over for the year. Clerk, open the rolls.
Nine ayes, 0 nays.
9-0. All right. Let's get, yeah. Okay, right now we have an interview for the new Secretary of Commerce and Trade. Madam Secretary.
Good afternoon, Chairman Wagner and members of the Senate Commerce and Labor Committee. My name is Esther Lee. I'm honored to stand before you for my confirmation hearing to be Secretary of Commerce and Trade. As you're aware, Governor Northam has committed that a significant focus of his administration will be on Virginia's economy through will be growing Virginia's economy through attracting new businesses, expanding existing businesses, and supporting small businesses throughout the Commonwealth. The governor has also placed a high priority on rural Virginia economic development, and I look forward to working with our rural legislators and communities across the Commonwealth to ensure prosperity for all Virginians. Please allow me to introduce myself a little bit. I've spent most of my career in the private sector in senior roles at companies like AOL, a formerly great Virginia-based company, Time Warner and Siemens. You probably know Siemens is a global conglomerate, not unlike GE, in businesses like healthcare, power, and transportation. And then I was honored to be appointed by President Obama to be a senior policy advisor to the U.S. Secretary of Commerce, where I had responsibilities in everything from economic development, innovation, entrepreneurship, small businesses, minority and women-owned businesses, the green economy, middle class, and rural economic development. I believe my background in tech, economic development, and business sectors have provided a great foundation for this role, and look forward to getting to know each of you, learning about your districts, and supporting economic and community development across Virginia. As you know, the Northam administration is structuring itself a little differently than past administrations by bringing technology under commerce and trade. This change also aligns a priority focus of the administration by breaking down silos and bringing these sectors under one roof. In today's economy, technology is embedded in all that we do and is no longer a set-aside, but a core component of the needs of all Virginia businesses and residents. Working with various agencies under commerce and trade, I will bring together our partners in economic and community development, as well as the business community, to advance Virginia's business climate, grow target sectors, and increase Virginia's economic development rankings. I'm aware of the great work that the General Assembly has done to improve the operations of VEDP, and I'm looking forward to working closely with VEDP as we take that organization to the next level. I pledge to you today to always be transparent and honest and serve as a partner between the administration and General Assembly for commerce and trade issues, as well as the Secretariat's agencies and Virginians impacted by the work that we do. So thank you again for this opportunity and look forward to answering your questions.
Thank you. Are there questions for Secretary-designee Lee? Apparently, we're not a very inquisitive group, but
I know you have a lot of business to do.
Well, we certainly had a chance to talk in my office, and I was very impressed. So, Chair will entertain a motion that Secretary-designee Lee be recommended for confirmation. So moved. Been moved and seconded that Secretary-designee Lee be approved for confirmation. Clerk, open the rolls.
$11 ayes, 0 nays.
Thank you.
For your
we
time.
look forward to working with you. Thanks so
Same
much.
here. Thank you.
Thank you. Okay, back to the docket. My first patron on the list is Senator DeSteffe. Senator DeSteffe.
Mr. Chairman, members of the committee, thank you very much for having me today. Today, at first bill, we're going to talk about Senate Bill 574, step therapy protocols. Step therapy protocols require health benefit plans that restrict the use of any prescription drugs through the use of step therapy protocol to have in their place a clear, convenient, and expeditious manner for prescribing medical providers to a request to override such restrictions of a patient. Step therapy is already referred to as fail-first practices. What we're asking here is not to eliminate step therapy, just improve the override process for everyone involved. Wouldn't you rather have a doctor who is sitting next to or across from your daughter, your son, make the decision on what medication to put your child on instead of a protocol that is based on averages? And we all know that our children and those things that happen to our children aren't average. We've got a couple of speakers here in support of this, and I'd like to defer my time to them because they truly are the subject matter experts, much better than I am. But we have probably 50 stories we could go through, but in the essence of time, we won't bore you with all 50 of them. But I will tell you that this is a critical matter, and just one of our local docs, his daughter was had a bleeding issue when she was pregnant, and through the insurance company, they put her on a blood thinner because that was protocol. Had she taken that, according to the doctor and the subject matter expert, her doctor who prescribed a different medication, she would have bled to death in 45 minutes. Not a good situation. So with that, I'd like to turn it over to a couple of our doctors who are going to talk to you a little bit more. They are truly the subject matter experts in this matter.
Just before they get started, and this goes for everyone in the room, we have 30 bills in front of us. At 5 minutes per side, that's 10 minutes times 30 is 300 minutes, divided by 60 is 5 hours, to give you an idea of the agenda that we have here. I'm going to put the 5-minute clock for each side, and I'm going to hold the patrons to it in the interest of trying to get through this docket. Okay, with that being said, and that applies to everybody and every bill coming up here. So the clock has started. Senator DeSteff, let's hear from him. Yes, sir.
Senator, I'm Dan Drysdale. I'm an ophthalmologist in solo practice in Blacksburg, Virginia. And I just wanted to relate a story. I was asked to speak at the last minute, so I haven't prepared notes. But I have a patient who was subjected to this step therapy, what I call fail first, because I feel like it's already failed. At least it failed him initially. This patient is 90 years old, is on a medication which is just barely controlling his glaucoma. The pressure in his eye, which causes optic nerve damage, has to be controlled with medication. He's not really a candidate for surgery at his age. So he's under control. His pressure has to be 12. It's been running 12, 13. I was asked by the step therapy protocol to try other medications. Even in the same class, I'm concerned that those medications might not control the pressure in this guy who's lost a lot of nerve function. If you have 1 million nerve fibers and 1 million ganglion cells leading to these nerve fibers, he's probably lost all but about 400. So he didn't have much reserve left. And so I was very hesitant, and I made every effort I could to work through this process and get him his medication. Fortunately, with persistence, multiple letters, I was able to get it, but I had to get an exception, and now I have to do that every year for him. That's just one of many, many examples of why this is not good therapy. In cases where there's an emergency, or whether there's, even chronic disease that leads to end stage, you don't want to take chances with these people. And Senator Steph was talking about these individual patients and the average patient. I've never seen an average patient. Don't know what one of those would look like. Wouldn't know how to treat them anyway. So, I do deal with individuals, and that's what we must do in private practice, face to face. Thank you very much for allowing me time.
Yes, sir.
Good afternoon. I'm Dr. Kent McDaniel. I'm the medical director for Enrico Mental Health. I've been involved with public mental health in Virginia for the last 25 years, public mental health for 35 years, right here downtown. And my role in public mental health is really multi-level. It's sort of working with individual patients, it's working with the system, and I do a lot of consulting at the state, national, federal level. I've worked with the Inspector General's office, all different levels of mental health. And I've even been on boards to help develop these STEP algorithms for insurance companies. And what I'd like to really stress for you is that when they make these STEP algorithms in medicine, and my role has been in psychiatry, they use evidence-based processes, but those processes are, as everyone has said, on populations. And those populations do not translate to how we provide clinical medicine. In fact, they don't coincide. So oftentimes, if you follow a STEP algorithm, it may make sense for 100 or 1,000 people who you're trying to inoculate against depression, but it doesn't work for individuals. And the consequences of that are catastrophic, not just for individuals, but also for the society at large. I'm going to speak in terms for psychiatric illness. People with severe psychiatric illnesses are the biggest cost we have in medicine, the biggest cost to our society with medical conditions. And the result is, if somebody doesn't get their treatment when they acutely need it, it isn't that the person's going to go home and maybe suffer more. They become a burden to the community. So they end up in hospitalizations, they end up with police involvement, they end up homeless, they end up in the state hospital, and it requires us to sort of make up for the difference. So what happens when I've worked all around the state, and I do a lot of consulting around the state for other CSBs, and so either in the less wealthy communities, what happens is they just practice bad medicine because they don't have time to function within. They just have to function within these poor algorithms. On the other hand, in the wealthier communities, like such as in Rico, Richmond, Chesterfield, Fairfax, we spend lots of money, lots of time, and lots of energy to make up for the fact that these therapies are poorly designed. The main thing that I would like to emphasize is that STEP therapies, though they make sense within their models, they don't make sense when it comes to patient and doctor interactions making the best decision. They also don't take into account the bigger picture in terms of they have to measure what they do, but then in terms of their outcomes, they're not measuring how many people went to jail, how many people were homeless, how many people had all these consequences, that cost is absorbed elsewhere within the system. I work with the police, and that results all the time because somebody couldn't get the medicine they need in the acute setting. And with the severely mentally ill, you don't have time or the capacity to have a logical conversation about why the medicine that they need, I can't get it at that moment. And it isn't necessarily to save money. Because oftentimes these algorithms, a layperson could see they make literally 0 cents because the medicine I might need might cost $4, right? It might just cost $4, and I actually go to the store myself and buy it for them. But according to their algorithm, I can't get that medicine. They may want me to use a more expensive medicine, which doesn't make sense for that patient. And so in terms of my role in terms of connecting with people, I'm out in the community because people with mental illness, you can't have a logical conversation with them when they're acutely ill. So where STEP therapy really falls down is when you really need it, you need to be able to apply what you can do at any given time. Last week, I was sitting on the ground behind a dumpster with somebody because that's the only way I could connect with them to convince them to take some medicine before they ended up in jail or homeless. And at that point, you can imagine, I've only got one chance to give them a medicine that's going to work for them. Or I was in a library just last week with a young man with severe obsessive compulsive disorder to the point of psychosis, trying to convince him just to try one medicine. But you can imagine, if I pick the wrong medicine, he's done. I have no other chance. I will never get a chance, at least for years, until he's back in jail or he's in the hospital. That's my chance.
Thank you, Doctor. The 5 minutes was up a minute ago. Bill, if you could just have the folks introduce themselves.
Michael.
And where they're
Good
from.
afternoon. My name is Michael Olex, actually. I live up in Ashland, Virginia, and I'm actually a patient with multiple sclerosis. When I was first diagnosed about 10 years ago, my first symptoms were all sensory, some facial paralysis, some deafness and whatnot, though. At this point, though, however, the severity of my symptoms have gotten much worse, and that's basically because usually the prognosis for men is much worse than women, which is normally the general in terms of where we have it, about 85-15%. I've actually been through 9 different therapies at this point, though. And at the time, originally, when I was diagnosed, the original therapy was $10,000 or so annually. Now the therapies are all about on par, but they're still almost $100,000. $90,000 annually, though, is billed to insurance, though, for everything, though. With this, though, what we're actually dealing with, though, is the problem in that the National MS Society normally recommends that we initiate treatment with an FDA-approved disease-modifying therapy as soon as diagnosis. Prolonged ineffective treatments, which is what I've been dealing with for quite a while now, and delaying access to the right treatment is going to result in disease progression. So when I was first diagnosed, I was completely able-bodied and whatnot, though, and as you can see.
Senator DeStefan, I'm sorry. I asked for 5 minutes. I explained the problem up front. We're now 7.5 minutes into it. And the other side still hasn't spoken yet,
Mr.
so.
Chairman, got it. I'll just have them introduce themselves by their name and occupation and that they
Thank you,
support.
sir, and I don't mean to cut you
I
off, but
understand, sir.
it is a
I
full docket, and we got a very late start. Yes, sir.
Thank you, Senator Wagner. My name is Dr. Harry Gawanter. I'm a pediatric rheumatologist here in Richmond, and I've been authorized to speak on behalf of both the Virginia Society of Rheumatology and the American College of Rheumatology in support of this bill. We have policies that show that this does not save money, and it only does hurts our patients and your constituents. So thank you for your time.
Thank you very much. Yes, ma'am.
Yes, sir. I'm Donna Gwynn. I'm with the National Patient Advocate Foundation, and we support this bill.
Thank you so much.
Mr. Chairman, members of the committee, Becky Bowers on here, and I'm representing the Virginia Hemophilia Foundation, the Hemophilia Association of the Capital Area, and the Virginia Breast Cancer Foundation, and we support this.
Thank you so much.
Mr. Chairman, Colleen Miller from the Disability Law Center of Virginia. We support. Thank you.
Thank you so much.
Mr. Chairman,
Senator Sproul.
now the others, I'm sorry, man, I apologize. Go ahead.
Claudia Stewart, I'm
yeah.
representing the Arthritis Foundation, and we do support this bill.
Thank you so much. Yes, ma'am.
Ashley Kenneth with the National Multiple Sclerosis Society, and we support this bill. Thank you.
Thank you. Does that conclude, Senator stuff?
Mr. Chairman, we're going to cut it off at that. We do
Well,
have-
I'm going to have you wrap up here in just a second. I want
Got
to
it.
hear from the post. Senator Sproul had a question. Senator Sproul.
Yes, sir, I had a question to the doctor. Then I had a question for you. One of the doctors who was up,
Let's see.
Yes.
either one.
Here we go.
No,
We got plenty of them. Yes, sir.
doctor, my question is, I'm hearing the step that he was talking about. And if I'm your patient, and I know, I talked with the insurance company in my office today, they were saying try step one first. As my doctor, you know my problem, my symptom. And so if you think that as your patient, you know me better than the insurance company, if you feel, you're saying that if you feel that I should start at step 3 than step 1, that I should not have to start at step 1 because as my doctor, in my system, are you saying I should start at step 3 instead of 1? That's the question.
Correct, sir. And about 80% of the time, there's not much disagreement because a lot of these protocols are ones that have been created by the specialty. But in your situation, for example, if you had rheumatoid arthritis and I saw you and you had very specific lab tests and looking through your history and your exam, I would say you've got, for example, a more aggressive form and you should be on medicine 3, not medicine 1. I would have to spend a number of weeks and quite a bit of time in appealing this to try to get that paid for on your behalf.
Thank you so much.
Thank you.
Yes, sir.
Okay, let's hear from the opponents.
Mr. Chairman, I'm Doug Gray, Executive Director of the Virginia Association of Health Plans. We oppose Senate Bill 574. The step therapy override bill would expand the provider's ability to circumvent a planned step therapy protocols, which is a tiered system that steers patients towards generics and cost-effective prescription drugs. The challenge that we would have is if under the language of this bill, anytime a provider wanted to skip to the steps, they could, and it would, in essence, make the purpose of a step therapy protocol invalid. There wouldn't be a reason to continue with it. 84% of folks are on generic drugs that work out very well. From our perspective, we're trying to make sure that people try so that 84% of the time they'll be in the right place on the right drug. The protocols, as stated earlier, are not created by the insurers. They're created by groups of professionals in each specialty, and we follow them. We do have internal and external appeals processes to move things quickly along. We did have some changes to this process a couple years ago. We're continuing to work on those with the Medical Society. Those exceptions involve us getting an answer to a provider within 24 hours if they call. So that's already required in state code. If they want to go straight to an appeal, we get them an answer in 72 hours. So it can happen pretty darn quickly. And it is required in the code today. So we will continue to work with providers to make this process work better. It is a partnership. We have to work together to make these steps work. I would just say to you that the State Employee Benefits Plan and COVA realized $40.25 million in cost savings avoided from prior authorization edits and step therapy edits and quantity management edits. That's a significant amount of resources. In this day and age, when the prices are set by pharma, we are not in a great position to manage when there are therapeutically equivalent drugs available. And so these steps are part of that process. Thank you, Mr. Chairman.
Mr. Chairman,
Yeah.
one very
Senator
quick
White.
question. What is the timeline on the appeal? So you've got 24 hours in which you can say, hey, we've got a problem, can you help? And if that's denied, what is the timeline for
An
the
urgent
appeal?
appeal has to be done in 72 hours.
72 hours, thank you.
Okay. Senator Newman.
Doug,
48.
so is it your understanding that this bill will in any way affect generic substitution?
It certainly would.
Well, Mr. Chairman.
Senator Newman.
Doug, I mean, as you know, the generic product is not chemically similar, it's chemically identical. The Orange Book of the FDA says it is clinically identical, not close, not in the neighborhood. It's identical. Is that correct?
Mr. Chairman, Senator Newman is correct.
Yeah, thank you, Mr. Chairman.
Senator Newman. Yes, Karen.
Thank you, Mr. Chairman. Karen Addison on behalf of the Pharmaceutical Care Management Association, representing the pharmacy benefit managers. We also oppose the bill. Thank you.
Thank you.
Mr. Chairman, members of the committee, Nicole Riley with the National Federation of Independent Business. A lot of our business owners who purchase health insurance purchase that in the individual and small group markets. We believe that these protocols are put in place to help control costs. Prescription drug costs are almost 20% these days of your premiums, and so we just think this is a good protocol to keep in place. Thank you.
Thank you. Any other folks opposed to the bill? Okay, Senator Steph.
Mr. Chairman, members of the committee, thank you very much. We're not asking to eliminate step therapy, just improve the override process for everyone involved. You heard here that, within 24 hours on an urgent one, and we answer everyone within 72 hours. Well, I checked with one of our docs, and that's only if they answer, only if they get a peer-to-peer review, only if. And one of our other doctors testified to, it takes weeks to get through the appeal process to get where you need to be. And this isn't about generics or not, because whether they do generics or not, it has to be in that specific step. So the generic side of it doesn't really matter. And then one last thing is, let's say there's 5 different medicines and the doctor knows that you need to be on this one. And in our local area in Virginia Beach, the first 3, and this was one of the cases that was referred to as the fee case, the first 3 on these psychotic psychosis type drugs basically altered the mindset of the individual. So you had to put them on it, it alters their mindset, and then it fails. Well, when they got on the second portion of step 2, when the doctor prescribed step 4, he was suicidal and committed suicide. So he never had the opportunity to get on step 4, which is what the doctor prescribed. It also, the doctor, every single day he was on the first step, the doctor kept calling, trying to get him on step 4, calling, trying to get him on step 4. That was Dr. Sao. Never happened. So we're just trying to accelerate the process, improve the override process, and make sure and help everyone involved on this. And
Okay.
Mr. Chairman, that's the bill.
Any questions for the patron? Okay, committee operates by motion.
Move approval.
I have a motion to report.
Mr. Chairman. No, I'm sorry.
I got a motion properly supported to report the bill. Senator Newman.
Mr. Chairman, does this include our own health plan, or are we going to continue step therapy with our own health plan?
I'm going to have to defer to the subject matter expert on that one. Let me find her. Sorry, when we get crowded like this, it's hard to see where everybody goes off.
Mr. Chairman, it would not, to do that, it would have to be language in the state plan section of the code.
Mr. Chairman,
Senator Newman, it's been the policy of this committee that we do not put any legislation forward on private sector insurance that we do not willing to impose on state employees also. That's been the policy of this committee. I don't know if we want to add that section on by amendment and send it to finance or not, but, you know, clearly this has a fiscal impact. But it's been the policy of this committee as long as I've been on the committee that we do not send any legislation forward regarding health insurance, and we're not willing to provide for our own state employees. Yes.
I hate to disagree with Mr. Gray, but in the definition of health benefit plan on line 23, it states that it includes any policy or plan providing health coverage to state employees pursuant to section 2.2, 2818. So I think they're in there.
Mr. Chairman.
Okay. Senator Newman, you have a substitute motion?
Well, clearly the bill has got to go upstairs. I'm not going to vote for it because I am very concerned that right now my constituents can't afford their premiums today. And the impact of this bill, especially if you get the psychotherapy drugs in there, is going to be a major impact on them. So I'd rather not make the substitute motion and go upstairs because I think I know what the bill is going to do to my constituents. But if it is going to pass, I think it probably should go upstairs.
Okay, I have a motion properly supported to report the bill.
Isn't it required to go to finance? I would move that it be reported, substitute motion, report and re-refer to finance.
Okay, it's been moved and seconded.
Mr. Chairman?
Yeah, Senator Sproul.
I haven't heard no indication why it should go to finance. I'm just saying, we know when you say upset the finance, that means go and kill it now. Don't, when you go upset it's dead. So, I mean, I'm trying to find out the reason, should it go to finance? I haven't heard why.
Senator Newman. I mean, Senator Norman.
He never looked that good, but Mr.
I hated to besmirch Senator Newman like that.
Mr. Chairman, I'm respectfully asking that if the bill is reported, that it do come to finance, please, sir.
Yeah.
Mr. Chairman, I understand what you're saying. I'm saying, but is there a reason why it should go to finance? I mean, we keep saying it go to finance. It got to be, is there a physical impact that should go to finance? You should say something. Instead of just cutting upstairs, it should be a reason why it should go upstairs.
Senator Sproul, I think Senator Norman has said that it does have a fiscal impact.
Okay.
And we need to determine what that is, and given all the priorities we have up there, where to spend money, what we'll provide money on. Okay,
right.
We have a substitute motion properly supported to report the bill and refer to the Senate Committee on Finance. Clerk, open the rolls.
Eight ayes, 6 nays.
Okay, the bill's of finance. Senator DeSteffi, you have another bill?
I have one more bill, Mr. Chairman, members of the committee. This one is prior authorization for drug benefits. So what this one does is it actually requires contracts between an insurance carrier and a participating healthcare provider that require the carrier's prior authorization of drug benefits to include a provision that prior authorization request is denied. The provider has the right to a peer-to-peer review with a physician advisor or peer of the treating healthcare provider who represents the carrier. Provision applies to provider contracts entered into, amended, extended, or renewed on or after January 1st, 2019. And Mr. Chairman, if I could, real quick, this is an issue, a large issue down in my district, in our district. We have a pediatric neurologist who's a little bit beyond that. She's also a neuromuscular neurologist. So she's kind of like a Ralph Northam +1. With the young man, Levi, who the lieutenant governor used in his speech as an example of the things we need to look at and find cures for, with Levi, she spent almost 8 hours on the phone on a peer-to-peer review with somebody who never went to medical school. Now, I can tell you, I looked it up and I talked to her. There's only 2 pediatric neurologist neuromuscular experts in the state of Virginia, one at EVS, EVMS, and one at VCU. And they work very, very closely together. So not only did she spend 8 hours trying to get a peer-to-peer review of somebody who didn't even go to medical school, we've got to do a better job. We've got to fix this situation. We've got to make sure that when a doctor requests a peer-to-peer review, it's expedited. And in the case of somebody like Levi, every day matters. Every day matters very critically. If we would have followed step therapy or what the original request was on the peer-to-peer review, Levi wouldn't be with us today, and he wouldn't have been sitting up there in the galley. So that's our pre-authorization. And we do have speakers on that as well, Mr. Chairman, and we'll try to do a better job.
No, we
focus
will
on
do, because
time.
I'm going to cut off. The last bill took 30 minutes, and we're now on a 15-hour pace to complete the docket, so. Okay.
Senator Wagner Committee, again, I'm Dr. Harry Gawanter. I'm a pediatric rheumatologist, and this is a situation I face all the time. When I'm taking care of children with lupus or juvenile arthritis and trying to get medication or therapy approved, I need to speak to a pediatric rheumatologist. And many of the times I'm speaking to a radiologist, a family practice doctor, or someone who's never seen any of my patients. And so we need to have within code the ability to speak to a true peer quickly and not spend a lot of time going through all this other stuff before we can get to someone who actually understands the situation. Thank you.
Thank you.
Dan Drysdale again, Mr. Chairman. I have much the same to say about prior authorization as I had for the other. Very brief story. One patient, I decided, well, I'll go ahead and take the route, make the call. I called some call center in Utah. I'm supposed to be talking to a pharmacist. Waited on hold for 20 minutes. Finally, someone answered, and I asked, "Are you a pharmacist?" "No, I'm a clerk." And so I said, "Okay, well, let's talk about this." And the end result of that was a denial. And so I just, it was just to find out how long is this pre-authorization going to take me, and I can't afford to take that kind of time. It's just, nobody's got time for that. So I don't do that. I send a letter. It's usually pretty hot. And about half the time, I'll get a good result. Half the time I don't, but that's the best I can do. But this is not a fun process.
Thank you.
Mr. Chairman, since we went over so much last time, I'm not going to have a lot of more people speak in favor of it. I'll just have them raise their hands if they support it. And I think that'll save us a lot of time and recapture a couple of the 30 minutes of the committee's time that we imposed on prior.
Thank you, Senator Steph. If you're in support of the bill, please raise your hands. All right, thank you very, very much. Okay, from the opposition.
I forgot me.
Okay.
Sorry.
Mr. Chairman, I'm Doug Gray, Executive Director from the Virginia Association of Health Plans. I think what may be happening is the examples that are being brought to you are from self-insured entities. Self-insured entities are regulated by the Department of Labor at the federal level. They do not follow the same rules that are in Virginia statutes. Virginia statutes already include the requirements that Senator Distaff is trying to put in his bill on Senate Bill 581. If you look at 321-137.14 reconsideration, a determination on reconsideration shall be made by a physician advisor, peer of the treating healthcare provider, or a panel of other appropriate healthcare providers with at least one physician advisor or peer of the treating healthcare provider on the panel. If you look at what a definition is of a peer and a physician advisor in 32.1-137.7, a peer means a physician or healthcare professional who holds a non-restricted license in the Commonwealth of Virginia or under a comparable licensing law of the state of the United States. Physician advisor means a physician licensed to practice medicine in the Commonwealth of Virginia. An example in which a physician, a non-physician, is on the other end of a physician advisor nor a peer, both of which are included in Senate Bill 581, could not happen under Virginia code. So I would suggest to you that the content of Senate Bill 581 is already addressed in 32.1-137.14 and in the definition sections. Thank you, Mr. Chairman.
Thank you.
Mr.
Are
Chairman,
there questions?
Sorry.
Senator DeSteph, did you have?
I'm not going to debate the opposition, but I did check with the two doctors, and both of them said that's incorrect, that both of these were not independent insurance companies. These were Virginia insurance companies, and I was just going to close with that. because I want to make sure we're accurate in the testimony we provide.
Okay, thank you.
Thank you.
All right, are there questions? All right, the committee operates by motion. Hearing no motion, Senator
Wow,
Steph.
I hear crickets.
Thank you.
Thank you very
Appreciate it.
much.
Thank you so much. What's it? All right, wait, hang on a minute, Senator Steph.
Chairman.
Yeah, Senator Newman.
Chairman, here again, I don't think it was independent insurances. It was self-insured. That's ERISA plans. That's what we're talking about. Number two is I just have a great fear that my constituents might have some concern about Medicaid, but the big concern is their premiums are going up exponentially. And so what we've got here is we've got to buy the bills. Let's see if we can't raise them a little higher. And I can't believe we're going to do that. I am deeply concerned about the growing rate of the healthcare premiums. And until we do something in this legislature does something about it, I don't think we should add on to those items. So therefore, Mr. Chairman, I would hope that we would pass by the bills indefinitely.
We have a motion, second and properly seconded to pass.
Mr. Chairman, Senator Newman, if I may, this is just like saying a peer-to-peer review is truly a doctor who has similar background, so you've got the same subject matter expert. You certainly want a bicycle mechanic working on your boat engine. So that's what we're talking about here.
Thank you, Senator Steph. Okay, we
Thank
have
you
a
very
motion
much.
properly supported. Clerk, open the roll. This to pass by indefinitely.
Thank you
15
very
ayes,
much.
0 nays.
Thank you, Senator Steph.
Mr. Chairman,
Senator Black.
I would just say, for Doug Gray, perhaps if the committee could send a letter saying, you know, we really take these appeal times very seriously and hope that the word will get out to the appropriate folks that they need to move those things expeditiously and comply with the law, if that could be done.
Okay, Senator Black, thank you. Okay, Senator Chase.
Thank you, Mr. Chairman and members of the committee. We're looking at Senate Bill 717 relating to agent commissions. I think this is a great transparency issue that I'm bringing to your attention today by the independent insurers. There are close to 30,000 Virginians who have health insurance license. They have recently been experiencing dramatic and last-minute changes in the compensation levels from the health plans. If you can imagine thinking you're going to get paid and then later realizing you're not going to get paid at all, it's kind of a problem. Health insurance agents are customer service representatives for the health plans and work to support the individual and large groups with their health coverage decisions and relationships with the health plans. To cut to the chase here, if you will, no pun intended, basically what they're looking for is transparency. They're not asking to be paid, although that would be nice, but whenever they're making a decision about which products to offer, they would at least not like to know which products they're going to get paid and which ones they're not. I can get all technical and read all the details if you would like that, Mr. Chairman, but I mean, that's pretty much the essence of the bill. I do have independent insurers who are here today that would probably like to just show support for the bill unless you have any questions.
Are there questions for the patron? Hearing none, those in support of the bill? Yes, we're ready to hear from Senator Chase.
Okay.
Be real quick.
There you go.
Be real quick, Mr. Chairman. Bob Bradshaw with the Independent Insurance Agents of Virginia. House Bill 717 is solely a transparency proposal that only asks that the health plans provide more information on their annual filings with the Bureau of Insurance. Annually, around June, July, the health plans file their rates with the Bureau along with a list of factors that may likely drive rates in the coming year, along with an outlook of what the future rate changes will be. In recent years, many of the health plans have announced to their agents that they're going to pay commissions in the coming year, only to change their mind. What changed? Without having this information up front, the Bureau can't ask the questions of what's changed and how that did impact the payment of claims or the administration costs of the health plans themselves. Again, Senate Bill 717 does not require the health plans to pay commissions only to report the expectations to the Bureau of Insurance. One objection we've heard to the bill, besides don't poke the bear, is that there's legislation in Washington, D.C. to take care of this. We're not exactly holding our breath for a bill to pass in Washington, D.C. to pay for this. The other one is that this code section might not be written to the right place, and we would just defer to the Bureau of Insurance for that.
Thank
And
you.
we've got Agent Lee to explain the bill.
Okay.
Chairman, Senators, thank you so much for your time. My name is Lee Bedricki. I represent Benefinder. We are a health insurance agency located in Chesterfield, Virginia. Represent over 400 agents throughout the state. 2016, we were given 2 weeks and 5 weeks notice that we would not be paid already inside of our fiscal year. In 2017, we were given 2 weeks notice before the annual enrollment period that our work for this year and last year would be paid at a rate of $0. In the group market, we were given 5-week notice that we would not be paid. And the only thing that we ask is that for the rates to be filed so that we can make business decisions on how we would charge our customers or how we would guide them through the health insurance process. Thank you for your time and your attention.
Thank you very much. Is the commission all right with this bill? Who do we have? We have anybody from the Bureau of Insurance? Yes. I'm sorry, yeah. Yeah, Tom, is you all right with the bill? Got it, thank you. Okay, is there anyone opposed to this bill?
Mr. Chairman, I'm Doug Gray, Executive Director of the Virginia Association of Health Plans. The way commissions work with plans is by contract. And they have a contract, and when they sign that contract, they know what the compensation would be. Matters of contract don't need to be filed in this way. It doesn't really help in any way. They can change it at any time, even if you have to file it. So I'm not sure if this really addresses the concern. The concern from the agents is plans did change their policies to pay them less or to not pay commissions at all. And they're not happy with that decision. And I can understand why you wouldn't be happy with that decision if you were an agent. But those were matters of contract, and they were informed of them when the change was made. And that's what would happen in this case. It doesn't really solve a problem. It really just creates another piece of paperwork. So as a result, we don't favor the bill.
Okay, questions?
Mr. Chairman.
Senator McDougal.
Doug, before you go away, if you were to be required to make these filings initially when you file your rates for the year, and then you decided to not pay the commissions, wouldn't the Bureau be able to go back and look at your rates overall and say this is a change factor and make a determination on your rates?
No. I don't think it would be a factor in the consideration of the approval of the rates. We're talking about a small commission that is decided up front. If you pass this, you may very well see a lot of zeros in their filings, which means they won't pay at all. And I don't think that's what the agents are after.
Mr. Bradshaw.
Mr. Chairman.
Yeah.
Mr. Chairman, or do you? Okay.
I'd like to get to, yeah. Would you care to comment on this?
Yeah, absolutely. If they file rates and originally they say premiums are going to be $100 and 80 of that's going to be on filing claims, paying for claims, and $20 is going to be administrative, but 3 of that is going to be for agent commissions, just as an example, and then those commissions go away, naturally you would ask the Bureau, okay, what happened to those $3? Did it go to administration? Where did it go? What happened? But if the Bureau doesn't know that information up front with the filings, they can't ask the question. So I think Senator McDougal is absolutely on point. They would have the information in which to follow up with the health plans and say what happened.
Okay, brought Mr. Gray up. I'm gonna hear one more time here.
Medical loss ratio is basically a regulatory cap on health plans. We have an admin cost and we have a health cost. We make a prospective judgment on where we're going to come on our MLR costs. If we spend more on the admin, then we have to rebate anything that goes on and over and above that. So this is not a significant factor in the overall expense.
It is a very small one, and a change could be a rather minor one or none at all. So I don't see how this really would play a major role in that process. It doesn't make sense. It's a prospective process on MLR. We make our projection going forward based on what we decide at the beginning. So I don't see how it could make a major change.
Okay, Senator
Mr.
Chase.
Chairman, I would like to make a comment of how this really will affect people. I called my my business coach earlier today to get his take on this bill because this is what I used to do. And my company stopped offering healthcare insurance because there was so much indiscretion, so much lack of transparency of how much these agents are going to get paid. So they stopped carrying it. So it's going to hurt the consumer. They're going to have less options. I think it's important to be transparent. I think the agents need to know on the front end how much they're going to get paid and the commission schedule. They're not asking to be paid. They just want to know up front what they can expect so they can plan. So that's all I have. Thank you.
Okay. Any questions for the patron? All right. Committee operates by motion.
Second.
It's been moved and seconded that the bill be reported. Any discussion? Clerk, open the rolls.
Eleven ayes, 4 nays.
That bill's reported. Is that, you have anything else, Senator Chase?
Yes, Mr. Chairman, I have Senate Bill 916, which is health benefit plans. It says sale by authorized foreign health insurance, but it basically just means selling insurance across state lines. I also have a substitute, which I'd like to be passed out at this time.
Okay, so motion on substitute. Been moved and seconded that substitute be agreed to. All those in favor say aye. Aye. Any opposed? Okay, the substitute's before us. Senator Chase.
Okay, so everybody has probably heard this bill before, so I won't get into the weeds here. Let me just briefly tell you that I did get a letter on my desk this morning from Scott White, the Commissioner of Insurance, that says that they are
Just a line amendment.
ambivalent about this. They're not going to oppose it. They're not supporting it. So let's talk about what this bill does. It allows for
Excuse me for just a minute, Senator Chase.
Okay.
Let me get it before us, okay?
Sounds good.
There was no substitute. It's a line amendment.
Line amendment, okay.
A line amendment.
My
okay.
apologies.
Big difference. So, okay, continue on.
So what this bill does is a couple things, 3 things. It allows for a commission to select foreign health benefit plans. We're just talking about out-of-state plans to serve Virginians without having to comply with state mandated health benefits if the foreign health plans do one of 3 things. They do not expose those covered by such plans in the Commonwealth to unreasonable exposure to risk as a result of the Commission's lack of jurisdiction to regulate the conduct of the foreign insurer. 2, does not place the market for health benefit plans in the Commonwealth at financial risk due to the foreign insurer's hazardous financial condition. And then finally, it provides appropriate protection for the consumers of foreign insurers' health benefits plans. Now I want to talk about why this is going to benefit Virginians. It does a couple things. This bill will allow for more health benefit plan options for the average consumer, which would in turn create a more competitive market with more personalized health care plans. We've been talking about this forever. This is something we need to do to drive down costs, create competition. A more competitive market will drive insurance costs down as more plans become available in the Commonwealth. And just 2 points about increasing access. The bill will allow for larger risk pools of insurance plans across state lines, allowing for more effective and larger cost sharing. Second, the larger pools will effectively lower insurance costs while simultaneously increase insurance access to the public. And then finally, consumers will have more choice as to what health benefit plans best meet their needs.
Okay, I believe Senator Sasslaw has a question for you.
Okay.
People don't have to be licensed by the SEC to sell here, is that correct?
The people, no, they are buying across state lines. So whatever laws are in whatever state they're purchasing, they're abiding by those laws of that state. Right.
Senator Sasslaw.
Question comes up, I file a claim and they don't pay it for whatever reason. Out of curiosity, who do I complain to?
You would go to that state's Bureau of Insurance.
Okay.
Whoever
So
the-
let's suppose that's, Mr. Chairman, let's suppose that's in Wyoming, okay? Do you really think that I'm going to get a lot of attention from an insurance commissioner in Cheyenne, Wyoming, for somebody in Annandale, Virginia?
I think that we should have, just like we do with our gun laws where we have reciprocity, we should be able to work that out with the other states.
Who works it out?
Senator Sasslaw.
Mr. Chairman, who works it out?
I'm sure I have some people behind me who can help me with this, but I would tell you that there would be folks, I mean, we're going to be having the reciprocity issues where every state is able to offer these plans and we're going to be shopping across the lines. So,
Mr. Chairman, so in other words, you don't know who I would complain to and what the chances are that I would be successful in a state 2,000 miles from here.
well, I would think that you would complain to the Bureau of Insurance of the state in which you purchased the insurance.
Senator Sasslaw.
Mr. Chairman, they're not licensed here, so what possible control will they have?
I'm going to have to defer. I don't know the answer to your question. I
Okay.
can get back with you on it.
That's fine, thank you.
Senator Norman.
Mr. Chairman, to try to cut to the chase, is somebody from the State Corporation Commission of Bureau of Insurance here can answer that question?
Come on up.
Hi, my name's Don Beatty. I'm with the Bureau of Insurance. I will try to answer that question. My understanding is, well, under 916, as well as similar laws for cross state lines, the person would complain to the insurance department in the state where the company is domiciled. So if it were a Montana company, I would complain to Montana.
Okay. Senator Sasslaw.
Okay.
Okay.
That pretty much is what I thought.
Okay. All right. Senator Chase, you have people to support the bill.
I'm sure that I do. Are you here? Okay. Do you want to explain the amendment? I don't think we're there yet. I do want to say one thing.
Yeah. Well, just a minute.
As far as selling across state lines, I mean, I understand this is a new concept, but we've got to start somewhere in driving down the cost with.
Senator Sasslaw.
That may be, but this, you talk about fraud and abuse. They can have licensing requirements, Mr. Chairman, in their own state that are nowhere near the requirements here in Virginia. And we have no way of collecting it. If you think, Senator Chase, let me just say this. If you honestly think that a commissioner in Montana is going to favor me over a Montana company, you're not living in the real world.
Mr. Chairman, I would like to respond to that by saying I think it's up to the consumer to decide where they want to buy their insurance, and we should let the consumer look at the disclosures and the disclaimers and make that decision on their own.
Mr. Chairman, that's why we have an insurance commissioner here, okay, to make sure that those kinds of shenanigans don't ever happen.
And Mr. Chairman, I would just say that every state is going to want to do their due diligence. They're going to have their own commissioner of in their state to protect their own interests, and I don't think they're going to want to sell a faulty product.
Thank you, Senator Chase. Let's have the clerk report the amendment. Let's get the amendment out for us.
Mr. Chairman, the amendment is on page 2. It would be at the beginning of line 100, insert a subsection C that states an authorized foreign health insurer shall not refuse to contract with a practitioner listed in section 38.2.4221, provided that the plan offered by the authorized foreign health insurer covers services that the provider is legally authorized to provide, and the provider is willing to meet the terms and conditions of the plan.
Okay, as I understand that amendment, it's a non-exclusion cause would you like to come up and speak to your amendment?
Chairman, Bruce Keeney, representing the optometrists, clinical psychologists, and the chiropractors on this. Principally, what this says is that should you move forward with this legislation, if the plan chooses to cover a service, that would be up to them. And providers are licensed, legally authorized to render that service, and they're willing to meet the terms and conditions of the plan, how much they get paid, what their credentials, then the plan is in a position that they can't refuse to allow them to participate. So everything's under the control of the plan, but it prevents outright discrimination. It also makes sure that the provider, that the subscriber has some hopeful patient, some provider out there to render the services should they choose to cover it. Additionally, and frankly, it increases some competition in Virginia because the providers in that list are all doctoral level, but in all candor, they're more cost effective.
Okay, is there a motion on the
Thank you.
amendment? It's been moved and seconded that the amendment be agreed to. All those in favor say aye. Aye. Any opposed? Okay, the amendment's been adopted.
Mr. Chairman.
Senator Newman.
Mr. Chairman, Amanda, I like where you're going because you're thinking about, right, trying to get premiums down. I have a question on line 98 and 99. Is the intent of those two lines of basically all those mandated health benefits that this committee has considered and passed and piled one on top of the other, increasing prices, that those actually will not apply to the foreign guys, that they can come in and kind of get around that? Is that what those two lines mean?
It says an authorized foreign health insurer shall not be required to offer or provide in health benefit plans sold, offered, or provided in the Commonwealth any state mandated health benefits. I mean, I'm open to any line amendments you want to add to that.
Mr. Chairman, just briefly.
Yeah, Senator Newman.
Was it your intent to exempt them from the mandated benefits? I think that was my question. We can
I'm
hear
not
more
sure.
testimony and you can think about it, but
Yeah,
I
that
thank
sounds
you for
good.
your consideration.
Okay, are there any opposed to the bill?
Mr. Chairman, I'm Doug Gray, Executive Director of the Virginia Association of Health Plans. Let me share an observation with the committee. If you want to authorize out-of-state sales and exempt out-of-state companies from the mandates that apply to the in-state companies, you can do that. You're also exempting them from every statute that applies to our plans, including every bill that you've discussed today, including the new requirement that you just passed. At some level, if you're going to go down this road, you should think about the equity between the plans that are being offered in state and the ones that are being offered out of state. The amendment you just adopted is actually harmful to the purpose of the bill. And any willing provider statute is about making sure that you protect the willing providers in this state by requiring the out-of-state plan to include all of them. Well, the more you include, the more the price goes up, because guess what? They'd like to use their volume, if they have any, and frankly they won't, to ask for a discount. That's exactly what happens in the health insurance business. Volume leads to discount. If you cannot use your volume to get a discount from a limited network, you cannot achieve savings. If your intent is to achieve savings, you shouldn't adopt the amendment that was just offered, because it undermines the purpose of the bill. I will be the first to acknowledge, and we're going to have a lot of discussion about this on other bills, the individual market is in a state of disaster at the moment for people who have to pay their entire premium. It's not affordable if you don't get a tax credit. So if you're above 400% of the federal poverty level under the ACA plans, the plans are not affordable, period. That's not a good place to be. And we're going to see a lot of bills around that. Association health plans are an idea to try to help provide a relief valve in regard to that. There are other bills that are out here that are about getting people out of the individual market into a small group market, if at all possible. So I want to acknowledge the problem, but we got to think carefully about the solutions. So we can't support this type of bill because it puts our members at a disadvantage and does expose your consumers to some extent. But if you want to think it through and try to make it something that works for the purpose you're trying to establish, as Senator Newman described.
Okay. Yes, sir.
Again, I'm Dr. Harry Gawanter. I'm a pediatric rheumatologist in Richmond. I would submit that you have sort of an experiment of this already with pharmacy benefit managers and specialty pharmacies going on where, for example, with Express Scripts, they are based in St. Louis and subject to Missouri pharmacy laws. And we have no control over the pharmacy or anything that happens, even if you are in Virginia and a Virginia prescriber. So I think and that has not brought down prices at all. and there's no ability to get any oversight from that if you're in Virginia. So I think I would echo that, that this deserves a lot more study before it gets implemented. Thank you.
Thank you. Yes, sir.
Mr. Chairman, members of the committee, Robert Barada here representing Express Scripts. Since the company was just named, Express Scripts is licensed by the Virginia Board of Pharmacy in order to operate in Virginia. Thank you.
Thank you. Are there any others? Senator Chase, let me just make a comment. Senator Newman and I have been wrestling with this for a while, and we recognize that we have got to get a handle on healthcare costs. We also recognize we probably set up a system in here over the period of the last 3 or 4 decades that's created a system that makes it very difficult to try to rein in healthcare costs. So we're about figuring out how to do this and legislatively do what we can to go back and look at the laws we've already passed, modify those laws, bring those laws into place. So we bring a number of things in, true competition, so that we bring everything that we can do at the state level to rein in these healthcare costs and God forbid, actually reverse the cost cycle if we're able to get there. We are dedicated both ourselves to select members from each of our selective committees, and we're going to invite the House members to join us to meet throughout the year to really try to get a set of policies that we can agree on. And this bill, we appreciate what you're trying to do here. We understand what you're trying to do here. We're trying to open up competition by bringing in folks that may have better ideas outside. Also, I'm sensitive to what Mr. Gray has said and Senator Saslaw's concerns about protecting our consumer and being able to do that. So with that explanation, I would ask for a motion.
Mr. Chairman, I think we've got to fix this, and I think that Senator Chase is trying to fix it, right? The problem is with line 98 and 99, all the Virginia plans are going to be in a competitive disadvantage because they're burdened with our mandated benefits. We've added mandated benefits on top of mandated benefits, and they're going to, and I don't want you to take it out because it's our fault. We've raised these costs in regards to this, so I don't want to get rid of it, and I don't want to keep it in because it's unfair. So, Mr. Chairman, I think this is the type of bill that we need to have a discussion about. If there could be a universal bill or a group of states that come together and understand what a plan looks like, I think that would be a good idea. I would hope that I would make a motion that we carry the bill over to next year and that the chairman of this committee and chairman of my committee
Chairman.
work on those 2 items.
Could I just make
Senator
a comment?
Chase, absolutely.
If I could please just make a comment. This bill is actually already passed out of the House. Would you want to pass the bill for the week so that we could get a hold of what happened with the bill in the House?
Well, it's the intent of this body that we do not take up anything that's going on in the House. We are worried about those bills at Senate, and then after crossover, we'll start worrying about what's going on in the House. So we have a motion before us. It's been seconded that the bill be carried over, and we will study this issue, Senator Chase. I can assure you that. This is going to be part of a comprehensive program. Clerk, open the rolls.
Fourteen ayes, 1 nay.
Okay, thank you.
Thank
The vote
you.
is carried over next session. Thank you. Okay, Senator Donovan.
Thank you, Mr. Chairman. I will do my very best to be brief. My first bill is Senate Bill 639, and I'd like to tell you a little bit about this bill, although I understand you've asked for it to go by a little while. But as we talk at marketplace cost, yes, I'm so sorry, there's a substitute, Mr. Chairman.
Okay, been moved and seconded that the substitute be agreed to. All those in favor say aye. Aye. Any opposed? Okay, the substitute's before us. Senator Donovan.
So the goal of this bill is to engage the consumer in cutting the overall cost of health care. And essentially the way that that is done is that we would direct health plans to create a portal that patients would be able to utilize. And quite frankly, most health plans have these portals already. But the difference would be that there would be a cost associated with a service. Let's say, for instance, you're going to have a CAT scan, and you could choose the location of your CAT scan, and that could either be at the hospital or at an outpatient center. And there are different facility fees associated with those two radiology centers. By incentivizing the patient to choose the less expensive center, we're going to lower the overall cost of healthcare. How are we going to incentivize them? We're going to share with them the cost of the service at the more expensive location and the less expensive location and engage them in a shared savings. If the health plan saves money because that patient chose a less expensive site, then they're going to share those savings with the patient. That's the essence of the bill, and I'm sure there are people that want to speak, but, you know, I think we had discussed passing it by for the week. What is your will, Mr. Chairman? I got word from my staff
I
that,
think this is a pretty significant change, and this is the part where we kind of bog down a little bit, and if we throw a substitute on, there's a whole lot of concerned parties here that really haven't had time to digest it. We've now completed 4 bills in 1 hour and change. And people are there. So without objection, we'll send this bill by for the week and let all the parties, this is the bill you're going to be looking at. So all the parties and, you know, the doors are open. We'll wait to hear discussion. Senator Donovan, do you have another bill?
yes, sir, Senate Bill 731. It returns us to a conversation about prior authorizations. And to be frank, this is a real strain on the small business that makes up your medical community. And we're one of the largest employers in Virginia. And this prior authorization bill works to tie down a few variables. In medicine, if you're going to perform a surgery on a patient, in most cases, that surgery requires a prior authorization. We call the insurance plan, get the prior authorization, and we have many instances where that care is then, we perform the surgery and it's not paid for, even though it had a prior authorization. There are challenges with medical benefits as well. You may have had constituents that have complained to you that when they go to get a refill on a prescription that's good for a year, they have to go through a prior auth process again. There's some debate, in all fairness, about half of the market for health insurance right now is this self-insured market. And while they are managed by the health plans that you're familiar with, they don't follow the same MEWAL rules that we have here in Virginia. They're governed under ERISA, and that's where some of this conflict arises. To dispense with this as expeditiously as possible, I was approached this morning by Medical Society of Virginia, and the health plans in the Medical Society of Virginia have agreed to convene a work group to work on prior authorization, step therapy, and iron some of these things out so that small businesses do not have an onerous weight on them to go through this process only to not get paid, and so that we can work out some of these nuances and improve the general exchange between the two entities. So I will have that pass by indefinitely while they work on that. They, you know, I will say one thing, they did volunteer to give a report to the Joint Commission on Healthcare in October so that we would know if there was a legislative agenda that came out of that group.
And Senator Donovan, do you want to pass by for the year or carry over?
Carry over.
Be
Thank
careful.
you
Be
for the
careful.
prompt.
Be careful how you
Yes, sir.
ask for
Thank
things.
you.
Okay. It's been moved and seconded that Senate Bill 731 be carried over. Clerk, open the rolls. Okay.
15 ayes, 0 nays.
That bill's carried over. Senator Donovan, do you have another one?
Yes, Mr. Chairman, I have Senate Bill 844. Senate Bill 844 is, again, one of these bills that is attempting to address the cost of the individual marketplace, as you've already heard expressed here today. And with this bill, essentially, it would direct any health plan that is participating with the state, either in a contract with Medicaid or with the state plan, to also participate in the individual marketplace, providing some increased competition. And I will tell you, this has generated a lot of really productive conversation. We're not quite there yet. And I would indulge, excuse me, yes. So, I mean, there's an opportunity for us to make some real changes that'll benefit the individual marketplace with this.
Okay.
So,
I believe Senator Deeds has a similar bill, so we get a twofer here.
I've got Senate
Senator
Bill
Deeds, you wanna-
671 that does, it's something close to what Senator Donovan's bill does in a different way. You know, the people that get their insurance from the exchanges, the highest rates in the country are in Albemarle and Charlottesville right now. And there are a lot of reasons for that. But I've got that bill and I've got another bill and I've got people here from Charlottesville that came to talk. If there's a way for this for my bill, I guess, to be rolled into her bill to take it forward, that's fine. But
Okay.
I'd like you to My witness.
Yeah, absolutely. Let's,
And Mr. Well, I'll ask
if
that
you want
after we
to
have
defer for
witnesses.
just a minute, let's hear from the witnesses if you had them come up from Charlottesville. Senator Deed, you're on the clock.
We're gonna roll it over?
Yes, ma'am.
Hello, my name is Sean Cosette. I live in Albemarle County. I live and work in Albemarle County. I own a small business, and I have been self-employed for over 30 years and have always purchased insurance on the individual market. From the onset of the ACA, I purchased individual healthcare insurance. I do not qualify for subsidy. In 2017, my Anthem Silver plan cost me $550 a month with a $2,200 deductible. In 2018, Anthem left the Charlottesville, Albemarle area and left us with one choice of insurance, and that's Optima. Optima is also owned by Centera, and Centera happens to own one of two hospitals who offer health care in the Charlottesville area, one of the only two hospitals that offer health care in the Charlottesville area. In 2018, a silver plan through Optima cost me $1,869 a month, $22,400 a year. That's a 300% increase over 2017 in 1 year, and that's actually more than my mortgage. Our premiums are the highest in the nation, which you just heard. Charlottesville, traditionally in the past, our premiums have been right at the median rate, which is about half of what they are for 2018. So we're very curious about this incredible increase. And I'm only one of over 1,000 people who are affected by this in my area. I have a book here of people's testimonies, stories of over 100 stories. If anybody would like to read them, I'd be more than happy to email you.
Do you want to email?
Oh, I can email them. We need help. We can no longer afford health care. We're people who are hardworking. Don't qualify for subsidies, and I'm here to ask for you all to support both Senator Deeds and Senator Donovan's bills.
Thank you so much. Senator McDougal.
Could I ask a question? Because I've received letters in my office from different parts of the state, not dissimilar to what you just articulated. What was one thing I didn't hear you say is, what did your deductible go up to? So 22,000 a year in premiums, and your deductible would be what?
My deductible would be $2,400. I also want to say that that plan is for an HMO plan. In an HMO plan, I don't know if any of you guys have HMO plans, but it drastically limits the doctors that you're allowed to see. It limits your in-network is very limited. And what I have discovered is that Optima has very much limited the physicians that practice out of UVA, and especially the specialist. I have a friend who has stage 4 breast cancer, whose doctor practices at UVA, and she is no longer able to see that doctor. I just think that's just incredibly cruel to ask somebody to have to switch doctors.
Senator Deed.
Mr. Chair, just the problem in Charlottesville, Albemarle, is the way the market is developed, there is only one insurer. And the story that she's telling is not uncommon. There have been emails sent to you of people who've seen their premiums go from $17,000 a year to $41,000 a year, from $14,000 a year to $29,000 a year. And we're just trying to get some relief by creating competition in the market.
An average family of 4 is paying $36,000 a year for a $10,000 deductible HMO plan. So
Thank you. We all have constituents, and we have people very close to it. And I struggle to pay insurance for 100 people in my shipyard every year, watch it go up. And thank God I sold it 2 years ago. I don't know how they negotiate healthcare rates now. So we appreciate it. Thanks for coming down. Oh, Senator Overton.
And let me just say, I've expressed this to some of the folks who are sitting out here in the audience. I think this is a problem that is even more acute in communities like Charlottesville and Harrisonburg. And, Charlottesville is kind of a 2-hospital community, but barely. And the Valley is a 1-hospital community. And with healthcare policy being driven towards, insurers that are affiliated with that hospital, and that healthcare provider, it's killing competition. And it is, I mean, and I've talked to some of these providers, but, you know, it is, and I know that they are doing what they've been incented to do, but it's a huge part of the problem, huge part of the problem.
I believe Senator Obenshain, there's going to be a couple of bills coming up here later on that might address
Mr. Chairman,
some
I'll
of
just
those
interject. There are over 30, there's 30 localities in Virginia that have only a single insured, that they have the entire market, and Henrico is one. So it's not just Harrisonburg and Charlottesville. So this is a pretty universal problem and a serious one.
So, Mr. Chair, I'd ask you to roll my bill into Senator Donovan's bill, and I think that Senator Donovan then is going to ask you to.
Well, if it's the pleasure of the committee to send it to finance where we can have a conversation about this, because this is going to dovetail with some of the other initiatives we have to tackle the marketplace and costs in general.
I know there's a few people that want to speak to it real quick, so. Mr. Gray, you're up again.
Mr. Chairman, I would rise on behalf of the Virginia Association of Health Plans to remind you that your goals here are to lower the cost of premiums and provide stability in the individual marketplace. This bill will accomplish neither. Forcing Medicaid plans who don't do exchange business into being in the exchange when the market is broken and not working well because the ACA is requiring it to operate in that way will not lead to a lower price. It will not lead to a more stable market. It'll just lead to a much more frustrated group of providers. I like the idea of sending it to finance for some further discussion. There are lots of unintended consequences that could come about as an impact on the Medicaid plans themselves. I have several plans that have never provided this service at any time on the commercial side in the exchange. I have carriers who are locked out of the market. There are a number of challenges that go along with this seemingly simple concept that are not going to achieve the desired outcome. Running from the individual market is what everyone's doing. And the reason they're doing it is because the premiums are outrageous, and they are. And association health plans might be an option. There are other ways to go, but forcing people to participate in a broken market doesn't create a different result. So thank you, Mr. Chairman.
And let me just emphasize that point. I know there's a couple of bills in the pipeline. One of them is associated health plans, which would allow the Chamber of Commerce to collectively gather anyone within the Chamber of Commerce who's interested in joining a group health insurance plan. So perhaps there's only one purchaser out there to go up against the one insurance company, or hopefully there's more than one insurance company. So that's in the queue. There's another one in the queue that talks to not-for-profits and the monopoly status that they current or exemption from antitrust laws. It's in the queue also. So there's a number of bills we still in this committee haven't taken up yet that will be addressing a number of issues as we start to do a little self-introspective about what we've done to ourselves over the last 30 or 40 years to allow us to put ourselves in the situation we're in right now.
Mr. Chairman, can I just jump on that soapbox?
Absolutely, Senator Obenshain, please do.
And to the point I was previously making, I mean, just think about this. If you've got a one hospital community and they've got their health plan and they also employ all the doctors in that community, I mean, think about the conflict of interest that exists. I mean, that health plan is deciding how much to charge in premiums. It may be the only health plan in that community. And you wonder why premiums are skyrocketing? They're compensating their doctors and themselves. So, I mean, I don't blame them, but it is a huge conflict of interest that's got to be dealt with.
Senator Obenshain, I'll even add one thing more. The nonprofit side of many of those hospitals is 10, 12, 13%, while the for-tax side of it, which happens to be the insurance plan, their profit margins are down to 2 to 3%. Isn't that amazing? So we're gonna be looking at a lot of different things, I can assure you, on this. Ms. Karen.
Good afternoon, Mr. Chairman, members of this committee. Karen Addison on behalf of Magellan Complete Care, which is one of the 6 Medicaid managed care plans in Virginia. And I'm just merely here to point out that Magellan does not offer an exchange product and are not currently able to offer one. So the consequences of this bill would be to force us from participation in the Medicaid program, which we are a proud participant of and would like to be able to continue to do so. So we appreciate the concerns that you've raised and the questions that you're grappling with, but wanted to make sure that you all were aware that Magellan would no longer be able to participate in the Medicaid program. Thank you.
Thank you. Senator Black.
If I could just clarify, as I went through this, I checked, and Virginia does not have a health benefit exchange, and this is what you're talking about?
Yes, sir.
Because there is no health benefit exchange, you would be out of the game.
Well, we do not offer, Mr. Chairman,
Yes.
we do not offer a commercial product. So our Medicaid product is the only line of business that we currently offer in Virginia, and we are not currently set up or are planning to be able to produce a product that could be sold on the exchange if this were to occur.
And that
Senator Black.
That exchange, that's under the Affordable Care Act, right? The health benefit exchange.
Yes, sir.
So that is part of the
Senator Black.
ACA. Thank you.
Thank you.
Mr. Chairman, members of the committee, Kara Gunther with VCU Health System, and speaking specifically on behalf of our health plan, Virginia Premier. We have traditionally been a safety net health plan. We, like Karen and Magellan, only have Medicaid and Medicare business and have never offered a commercial product. So we, like Magellan, would also be unable to participate in Medicaid programs moving forward if this bill were to pass in its current form.
Thank you.
Thank you.
Any other Karens wish to speak? Seeing none, the chair will entertain a motion to roll Senator Deeds' bill into Senator Donovan's bill.
I move that, Mr. Chairman.
Okay, we're rolling Senate 887 into Senate 671. It's been moved and seconded. Those bills be rolled together. Clerk, open the rolls.
I think it was 671 to 880.
Yes.
I'm sorry.
Yes.
Okay. Yeah.
Did you have another?
Aye.
one?
Aye.
Or is it different? Okay, got it.
We don't need a motion. Just by voice. Okay, all those in favor say aye. Aye. Any opposed? Okay, those two bills are rolled together. Senator Donovan, I want to continue the discussions, and this has a fiscal impact. So while we continue the discussions, the chair would entertain a motion to report and re-refer to finance. Been moved and seconded that the Senate Bill 844 and Senator Deeds' bill, which is now rolled together, be reported and re-referred to the Committee on Finance. Clerk, open the rolls. Okay.
11 ayes, 1 nay.
11 ayes, 1 nay. That's, oops. Let's try it again. Story that roll. Clerk, open the rolls. Okay.
13 ayes, 1 nay.
Picking up steam, Senator Donovan. Okay. That bill's been reported and re-referred to Committee on Finance. Do you have another bill?
I do,
All
Mr.
right.
Chairman. The other bill is actually your bill and my bill, 934. Would you like me to present that, or would you like to speak
Absolutely.
to it? Very good. So 934 is a benefits consortium, and this is what the chairman spoke to a few minutes ago. We have in existence two benefits consortiums essentially in the state of Virginia for independent colleges and for the bankers. And it's an ability for the an association to set up a self-insured, or it does not have to be self-insured. It can be run through the healthcare company's plan so that their members can buy a low-cost alternative to what's available in the marketplace. So this would give a reasonable and alternative option to small businesses throughout Virginia. And it actually is written in general language, so it could apply to NFIB as well. And I think there's even some conversations that NFIB and the Chamber of Commerce may work together to execute on this and give some sense of relief potentially to our small businesses.
It's a really good bill, Senator Donovan.
Oh,
So,
thank you.
You're welcome. Are there those that wish to speak in favor of the bill? Whoa.
How about that?
All right.
Got your heart medicine, Mr. Chairman?
Let me get my heart started again. Okay, go ahead.
So, Mr. Chairman, this bill is a good idea in concept. One recommendation is it's written in Title 59.1, which doesn't quite make sense. 38.2 is really where the insurance code is. And what this bill does do is make sure that you have legitimate associations involved. They have to be associations that have been around for a certain period of time. I believe it's 10 years in this particular bill. And in addition to that, it's 5. Is it 5 in this bill? I thought it was 10. It's 10 in this bill. There's a bill in the House that has 5. It also requires some reporting of their ability to pay claims. So they have to have some evidence that they have the resources to basically support the business they're in. Reporting those resources and having somebody manage it at the Bureau of Insurance makes a lot more sense than having it in 59.1, which I think is really the Secretary of Commerce's code section, where I'm not sure they really know much about it. The language is almost the same as the bill that was in the other body, except it happened to be under 38.2. So my suggestion to the patron would be to just change the code section. And I think that would probably
I'm going to defer to council to comment on that.
Mr. Chairman, as was mentioned, there are 2 existing plans like this. The one with the bankers is in Title 6.2. And the one dealing with the private colleges, I believe, is in Title 23.1. For those association plans, the thought was they wanted to stay out of Title 38.2. And since this deals with organizations that are 501c6, which are basically business organizations, that's why I was in Title 59.1.
Okay. Munyon 1, Gray nothing. Okay.
And Mr. Chairman, I neglected to move an amendment that I have from the Chamber of Commerce.
Good.
That Mr. Munyon has.
Clerk, if you'd report the amendment.
Mr. Chairman, the amendment would be between lines 43 and 44, insert a definition. Sponsoring association includes any wholly owned subsidiary of a sponsoring association.
Okay. Committee understand the amendment? I have a motion on the amendment.
Move to report.
Any amendment? Okay, it's been moved to second and the amendment be adopted. All those in favor say aye.
Aye.
Any opposed? Okay, that amendment's been adopted.
Mr. Chairman, members of the committee, Ryan Dunn with the Virginia Chamber of Commerce. Want to thank both you and the Senator Donovan for helping with this legislation. 2 things. We want to make it easier for employees to get back on their employer's plan. That is the real gist of this legislation. Secondly, it allows employers to choose the appropriate benefit that's right for them. That flexibility is something we've been working for since the ACA went into place. And really, if Virginia wishes to change and encourage employer groups, this is a good start. We also see it as that we've put in some real consumer protection in this legislation. We want to make sure those things stay there. And then ahead of the federal rules that we know are coming down the pipe, which might be some concern from folks, we actually see this as getting out on the head of the curve, having Virginia be in line to say, here's what we're going to do in Virginia, while we not wait on the federal government to come down with their ruling. So we hope you view this bill favorably and move it along. Thank you.
And if I'm not mistaken, Mr. Dunn, if you're an SCP, small business, 1 or 2 people, but you're a member of one of these associations, that'll qualify you so that perhaps you don't have to go out and look at the bronze, silver, or whatever plan. You can get the benefit of being, basically have the rates of a much larger firm.
Yes, sir.
And the stability that comes with that. I offer that up to the young lady that came from Charlottesville that spent all this time coming up here. We appreciate it. And that's kind of what I was referring to earlier. And it's something that we think is a huge move. And I'm happy to put the bill in, and I'm glad Senator Donovan, as a doctor,
Mr. Chairman.
is also doing that. Senator Black.
Just a question. I noticed in the summary that it talks about the benefits may provide prescription, drugs, dental, and vision coverage. Is it limited to that, or that seems awfully narrow? Or is it intended to go beyond that?
Mr. Chairman, it does go beyond. I think that is just in addition to general health care coverage, those things may be included in the plan as well.
Okay.
Yes, sir.
Any other questions? Yeah, Nicole.
Mr. Chairman, I'll be brief, but thank you and Senator Donovan for bringing this forward. For our small business owners, the biggest thing since for 30 years has been healthcare costs. That's been their number one problem. And so anything that we can do to bring choice to the table, bring more affordable choice. Unfortunately, what we saw after the ACA was passed is that those of our members that did not offer health insurance before the ACA because of cost still don't offer it to this day because it's too costly. So we think this will bring some more affordable choice to them, and we support the bill. Thank you.
Thank you. Any others? Do we need to roll my bill so we're both chief co-patrons, or is that?
I think this
Take-
is your bill. Are we both,
Oh,
aren't we
this is my
chief
bill. Okay.
co-patrons on this? We should be, if not.
Okay. No, I don't have a go to finance. This is for small business.
I think he's supposed to be top
All right,
dog.
great. All right, Chair will enter. Is there anyone opposed to the bill? Whoa, that's the first today.
Peace in the valley.
Peace in the valley. Been moved and seconded that Senate Bill 934 as amended be reported. Clerk, open the rolls. Wait a minute, I got a bunch of people to vote for. All right,
14 ayes, 0 nays.
get bills reported. Senator Donovan, do you have another?
This is my last one, Mr. Chairman, and this is
I
Senate
feel like
Bill.
Animal House, yes? Thank you, sir. May I have another? Okay,
This is Senate Bill 935,
okay,
and I believe there's an amendment to this as well. Substitute, excuse me.
okay. Motion on the substitute. Moved and seconded, the substitute be adopted. All those in favor say aye. Any opposed? Okay. Senator Donovan.
Mr. Chairman, this bill is built on the premise of 934 in that it is removing some of the language from our code, specifically what defines a bona fide association, because that has been somewhat obstructive in entities being able to join together and offer health plans. And so this is a way to create some additional opportunities for individuals and associations and creative new groups that are getting together. There's one that's associated with Bon Secours, for instance. And so there are a multitude of entities that are springing up that are trying to establish a footprint in the marketplace. And by removing these bona fide exemptions, which say they cannot get together only for insurance or that they have to have been in existence for more than 5 years, some of those regulations have strangled those initiatives. And if we can remove that language, it'll free up a little bit of wiggle room in the marketplace.
Okay, are there questions for Senator Donovan? Hearing none, is there anyone opposed to the bill? Been moved and seconded that the amendment in nature substitute to Senate Bill 935 be reported. Clerk, open the rolls. Okay.
14 ayes, 0 nays.
Thank you, Mr. Chairman.
Thank you, Senator Donovan. Who is next? Senator McClellan. Thank you for being so patient.
Thank you. I have Senate Bill 907, and I have a substitute.
Okay, is there a motion on a substitute? Been moved and seconded that the substitute be adopted. All those in favor say aye. And, okay. Any opposed? By a vote of 1-0, the substitute's adopted. Senator McClellan.
Thank you, Mr. Chair. Senate Bill 907 codifies the no copay contraceptive drug device and procedure coverage requirements of the Affordable Care Act into Virginia law, safeguarding these essential benefits for all Virginians, regardless of what happens with the Affordable Care Act in Washington. Since 2012, Virginians have reaped both economic and health benefits from the no copay comprehensive coverage of contraceptives defined by regulations as part of the mandated coverage of women's essential health services. And this would, again, codify these benefits in Virginia law so that whatever, there's a lot of uncertainty about what's going to happen with the Affordable Care Act, but this would enshrine these protections in Virginia law. By 2015, over 55 million women in America have used contraceptives and had coverage. And a 2015 Kaiser Family Foundation survey found that over 77% of women and 64% of men support laws requiring health insurance plans to cover the cost of birth control with no copay. 2017 poll showed that over 77% of women do not want these benefits to stop. I think it's important to note that contraception is about more than just preventing unwanted pregnancies. I first started using contraception when I had recurring ovarian cysts, and the birth control pills were prescribed as treatment that basically made the pain stop and made those cysts go away. For some women, and I think of a patient in particular that my doctor told me about when I got pregnant for the first time, and we started discussing some of the, often overlooked portions of the debate on contraception. Is he had a patient who had a hole in her heart, who was married, who needed to be on birth control because if she got pregnant, she would die. There are, as you get older, and this is something that I'm about to have to make a decision on myself, the pill itself is not as effective, has other side effects that can endanger your life, and an IUD may be a better option for you, but an IUD is much more expensive. And so what no copay birth control does is take the cost of these preventative measures off the table, and you can make decisions based on what is right for you, not whether or not your insurance covers it or whether you can afford the copay. And with that, I am sure there are a number of people who want to testify on this bill.
Okay. Are there questions to the patron? Okay, let's hear from the proponents of the bill first. And you are on the clock, Senator McClellan.
Good afternoon. My name is Dr. Wendy Klein. I'm a physician whose lifelong career has been focused on improving the health of women. I'd like to ask, is there anybody on this committee who does not want to reduce unintended pregnancy? Anyone? Because here is your opportunity. We know that eliminating cost as a barrier to effective methods of contraception is associated with increased uptake of these methods, which in turn has been shown to contribute to reducing unintended pregnancy and abortion. We know that there are well-established negative health and socioeconomic outcomes associated with unplanned births, including delayed prenatal care and negative birth outcomes. We know that the ability to plan pregnancies allows women the time and resources to invest in education and participate more fully in the workforce, benefiting not only themselves and their families, but also society as a whole. Others may claim that providing no copay contraception coverage is somehow a religious infringement, but we know that there are existing broad religious exemptions mandated by law. This bill is simply good health policy and sound fiscal policy. If you allow copays to be imposed on birth control, you are creating an undeniable obstacle for women and one that impacts many thousands of women. As Senator McClellan pointed out, there are many reasons that contraceptive medications are used. I implore you to do the right thing for the women of the Commonwealth. Thank you.
Senator McClellan, you have 3.5 minutes. Yep. Yes, ma'am.
Good afternoon. My name is Tarina Keene. I'm the Executive Director of NARA Pro-Choice Virginia, and we are here to support SB 907 because this bill makes sense to protect access to no copay birth control for Virginia women, especially in light of the constant attacks and the threats that we are seeing that will roll back this extremely popular and important benefit from the federal level. This bill simply enshrines current federal law into state law. It does not ask health insurers to do anything that they are not already doing. It is merely a proactive measure that protects this benefit should the Affordable Care Act be dismantled. Furthermore, as represented here today in this room by all the women you see behind me, the women of Virginia overwhelmingly support this provision, and they voted to protect health care access, especially reproductive health care, this past November. Nearly 4 in 10 voters ranked health care as their top priority over any other issue. And nationally, despite party affiliation, the no copay birth control mandate is one of the most popular portions of the federal health care law. And we're also seeing women out marching in the streets around the Commonwealth and around the country. Access to contraception is a win-win issue for women, for families, for candidates running for office, and most importantly, it is good policy. Virginia women are also afraid of losing this important benefit. The fear is understandable because birth control pills can run anywhere between $160 to $600 annually, and IUDs and implants can cost anywhere between $500 and $1,000 upon initial insertion. These costs can be prohibitive for many women and families, and this could lead to an unplanned pregnancy, which could put even more financial and emotional stress on struggling families. That is why this is critical that you protect access to no copay birth control for Virginia women and families. Thank you so much, and we appreciate your support.
Thank you. Senator McClellan, you have a minute left.
Hi, my
ma'am.
name's Jessie, and I'm a constituent in SD 12. Before the ACA, I found myself working a full-time job without benefits for the first time in my adult life. I was 26 and uninsured, and I'd been on birth control since I was 16 due to a diagnosis of PCOS. Without insurance, I couldn't afford the yearly doctor's visits to receive my birth control prescription, and also couldn't afford the special prescription I needed to be on for the controlling of my cysts, which was $50 a month even when I had insurance. Due to this, I ended up in the ER from pain associated with a large cyst that had formed on my left ovary, leaving me unable to stand, much less work at the time. With the addition of no-cost birth control to the ACA, I no longer have to worry about affording my birth control and ending up incapacitated from pain.
Thank you. Yes, sir.
Good afternoon. I will be speaking on behalf of Alejandra Pablos. Hello, my name is Alejandra Pablos, and I'm the field coordinator for the Virginia Latina Advocacy Network, and I'm here to support SB 907. I work with Latinas and Latinxes from the LGBTQ community daily in the Commonwealth. Every woman and person should have access to affordable birth control that is right for them, no matter where they live, where they work, or how much money they make. Every day I meet and work with young people who have to support themselves financially, usually because they come from mixed status families and working families. Young women want to be able to make decisions for themselves. They want to focus on higher paying jobs and education. They want quality health care to cover birth control because most of them do not even make $15 an hour. And having birth control at no cost will be a relief for many people from that financial burden. They will be able to take better care of themselves and make better informed decisions. I myself have struggled to afford birth control in my lifetime, and I am here to speak on behalf of women and women of color and people who want to choose when and if to start a family. Please support preventative reproductive health care at no cost so that all women, regardless of their economic status or race, can access basic health care. Thank you.
Thank you. Senator McClellan, I'm just going to ask you to let each of the proponents just introduce themselves
Thank you.
and tell us they support it. Yes, ma'am.
Hi, I'm Tanisha White, and I support SB 907.
Thank you so much.
Good afternoon. My name is Judith Shamir. I'm from Vienna, Virginia, and I support this bill.
Thank you so much. Yes, ma'am.
Hi, my name is Amanda Braun. On behalf of Autumn Clemmis, Senate District 6, please vote yes.
Thank you so much.
Hi, my name is Monica Hutchinson from Henrico County, and I support this bill.
Thank you, Monica. Thank you. Yes, ma'am.
Mr. Chair and committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia. We strongly support this bill and ask for your support. Thank you.
Jennifer. Yes, ma'am.
My name is Casey Chavez, and I'm from Fairfax, Virginia. Please support this bill.
Thank you so much.
I'm Beverly Latolati from Prince William County, and I have a daughter who has for many years needed to take contraceptives, not for contraception, but for other health-related issues.
Thank you, Beverly. Thank you.
Rebecca Gottwald, Fairfax. I support 907.
Thank you. Yes, ma'am.
Good afternoon. I'm here on behalf of Brittany Shook of Charlottesville, who supports this bill.
Thank you. Yes, ma'am.
Hello, I'm here on behalf of Darlene Flucker from Virginia Beach, and she would like your support on this bill.
Thank you. Yes,
Hello, I'm Michelle Wooten from Hampton, Virginia, and I support this bill.
Thank you.
Good afternoon. My name is Gail Dady. I'm here on behalf of the ACLU of Virginia, and we support this bill.
Thank you. Jennifer, thank you for that. Are there opponents to the legislation? Yes, sir.
Good afternoon, Mr. Chairman, members of the committee. Jeff Caruso with the Virginia Catholic Conference. On behalf of Virginia's Catholic bishops and their two dioceses, We oppose this mandated coverage of contraception and sterilization that's included in the bill. I'm also authorized to say that the Family Foundation opposes the bill, as well as St. Francis Home, which is a faith-based organization that serves the elderly in the Richmond area. This bill does not codify existing federal law. There is a very, very narrow religious exemption in the bill, but the vast majority of entities with religious and moral objections would not fall within this substitutes religious exemption, and that is why it does not conform to federal law. The federal law has a very broad religious and moral exemption that goes well beyond this. And in fact, it's the narrowness of the exemption in this bill that's led to a lot of federal litigation, and we have an expert witness that very briefly can explain that further to you.
Thank you. Yes, sir.
Mr. Chairman, members of the committee, my name is Kevin Walsh. I'm a Virginia lawyer, law professor at the University of Richmond, former law clerk to Justice Scalia. For this bill, I am speaking from 5 years of experience litigating this at the federal level on behalf of the Little Sisters of the Poor. I'm not here today on their behalf or on anyone's behalf, but I can tell you that if this law passes with this very narrow religious exemption, there will be clients because this violates your own very good Virginia religious freedom law. So that's number one, is this is going to replicate what's happened on the federal level, which is years of lawsuits that have not advanced to any particular interest. And at a second level, apart from the religious exemption, I saw that there's a number of supporters from Planned Parenthood. They, I'm sure, are familiar with the Guttmacher Institute, which was formerly affiliated with them. And a study that the Guttmacher Institute put out asked, the title is, Did Contraceptive Use Patterns Change After the Affordable Care Act? The conclusion is, our research finds no evidence the ACA was associated with changes or improvements in contraceptive use patterns. And so if you're not replicating at the federal level because the exemption is too narrow, it will lead to state lawsuits. And even if this whole thing gets implemented, it won't have the effect desired.
Thank you so much. Any questions? Okay. Yes, ma'am. Despite what the clock says, there's 2 minutes left, okay?
Thank you. Mr. Chairman, members of the committee, I'm Catherine Carney. I'm the benefits manager for the Catholic Diocese of Richmond. In my position, I oversee all the benefits for approximately 3,000 employees in 24 diocesan schools, 145 church parishes, and the central administration offices. Since the inception of our plans, health insurance plans, we have never included coverage for contraceptions, and we could never include this in our coverage. In the Catholic Church, contraceptive use is not consistent with longstanding church teaching. We do have other associated organizations with the Diocese of Richmond who cannot comply with this bill because they do not primarily hire or serve Catholics. Thank you for your time.
Thank you so much. Okay, there's 1 minute left if anybody else. Okay. Senator McClellan, would you like to wrap up?
Thank you. I think it was my intent to replicate the benefit as it is in the Affordable Care Act. If we need more work to make that clear, I'd be happy to do that. But I think we all know what's going to happen here today. But I thank you for hearing this important bill. And I just want to reiterate that not all birth control is used solely to prevent unwanted pregnancies. There are medical benefits of them, and particularly with IUDs and longer lasting forms of birth control. Sometimes the cost is cost prohibitive, and this bill is an effort to help with those.
Mr. Chairman?
Senator Sproul.
Speaking to the bill?
Yep.
I'm hearing what both sides saying. But first of all, from a religious point of view, I'm not Catholic. I mean, that's what they believe. That ain't what I believe. So I'm not Catholic. So I'm concerned about the health of a person. I'm concerned about, we cry all the time as far as poor people having babies, and you can't afford them. And so then what happens? They go on welfare. So you complain about that. So you don't want them on welfare, but you don't want to give some keep from having babies. Let the family decide. So I resent one religion's coming up here and saying what they are. I belong to St. Joe, the Emmy Zion Church. So, I understand what you're saying, but I want to protect women for safe, healthy, as far as some McCollum saying for the She may have to change later on because she's getting a little bit older and want to protect that. Some take them because of other reasons, but mainly concerned about poor people who we are trying to say to them that don't have babies. And then if you come and where I was raised, I'm not poor now, but in the projects, and why these poor people keep having babies for babies? Why don't they do something? And then they have babies, and then you complain about their own welfare. Don't have it, but you're on welfare. What can we do? So I just think, though, you got to do something to make it safe. So we were saying, don't use no rocks and go to these other methods of having babies. They kill themselves. We were saying, make it safe. This is a safe way of doing it. Let the family decide. Don't let some religions decide on it. Let the family decide. So I'm hoping that Jen, they're not going to support it, but I'm hoping that if you would do that, whenever we can look out for the safety of the families and the babies, whenever we can do that, and stop playing politics and don't let the church decide. I'm a Methodist. I'm not Catholic.
Otherwise, Senator Newman.
Senator, a couple of things. One, we've worked together for a long time. As you know, I'm very much in favor of birth control, and as a matter of fact, I'm in favor of emergency birth control and some other things because they delay or eliminate ovulation, and that's about as pro-life as you get to be there. I think but that's not everyone's belief. My question, I guess, is that at least, except for the religious exemption, this is basically current law that you are codifying. Is that correct? Basically, right now, except for the religious part that there may be a diversion from federal law, basically, we wouldn't be plowing any new ground, no new benefit with this. It would be only the existing benefit and codifying in Virginia law. Is that correct?
Yes, that is my intention.
Well, Mr. Chairman.
Yes, Senator Newman.
So, I mean, I don't know if we do it here or do it upstairs, but, I mean, to me, if something changes, then it's the time that we should probably look at it. That's just my opinion. And in general, I think that we should be very, I'm very much in favor of birth control at that time. We could find the ones. There may be certain birth controls that maybe this couldn't apply to or members of this committee can't agree on, but for the most part, I imagine that most here are generally in favor of it. So, to me, I don't think we need to do this year, and then I think we could look at it another year, but if there's other thoughts, I can hear from the committee first before making a motion.
Are there other members who wish to comment? Okay. Well, the committee operates by motion.
Second.
Been moved and seconded that the bill be reported. I do have a note that the motion would have to go to finance.
I'll do it here. Mr.
It's
Chairman.
been moved and seconded that the bill be reported and referred to Committee on Finance. Senator
Mr. Chairman,
Newman.
I think that my motion would be that a substitute motion that we carry the bill over for the year, and then we determine what happens with the ACA. Likely nothing, but if anything does happen to the ACA, we'll have the vehicle to address it then.
Okay, there's been a substitute motion that the bill be carried over to next year. Is there a second? Okay, it's been moved and seconded that the bill be carried over to substitute motion. Clerk, open the rolls. Okay. I believe everyone's.
12 ayes, 1 nay.
Okay, that bill's been carried over.
I thank you for your
Senator
attention.
McClellan, any others? Okay.
No, thank
All
you.
right. Next, Senator McPike.
Thank you, Mr. Chairman. Senate Bill 663, I think we have a committee substitute.
Committee substitute. Is there a motion on the substitute? Been moved and seconded that the substitute be adopted. All those in favor say aye.
And Mr. Chairman,
Any opposed? Okay, the substitute's before us.
This bill is dealing with air ambulances. This substitute conforms to a House discussion that's going on and is also proceeded in the past. This also puts the bill in a position in code section appropriate for education and health, and would ask the committee to pass it on to the Committee on Education and Health.
Okay, is there a motion to refer this bill to Committee on Education?
So moved, Mr. Chairman.
Been moved and seconded that the bill be referred to the Committee on
Chairman.
Health and Education.
Mr. Chairman, I don't want to stop the train, but this is a big issue, not just in Virginia, but nationally. And there's a tremendous problem because there's so few providers and how those services are being handled, and particularly for our rural areas. It really, I thought this was a different one. I'm sorry, Mr. Chairman. There's one dealing with.
It sounds supportive, so I appreciate it.
Okay, all right. It's been moved and seconded that the bill be re-referred to the Committee on Health and Ed. Clerk, open the rolls. Okay, Senator, close the rolls.
11 ayes, 0 nays.
Okay, that bill's been referred. Do you have anything else, Senator McKay?
Yes, Mr.
Okay.
Chair. Senate
All
Bill 642.
642.
This is a bill that you've seen last year that passed this committee dealing with cancer presumption laws in regards to firefighters in the service. It adds the colon. We've had the discussion last year of diagnosis being colorectal or rectal, and depends on how it's described, how it impacts the law. Additionally, this bill before you also strikes out the provisions related to the International Agency for Research on Cancer. And I can tell you from experience, Mr. Chairman and members of the committee, over the last year, since the last time we discussed this in committee, I had the unfortunate circumstance of having to deal with one of my constituents, a fellow firefighter in the city of Manassas, who was diagnosed with pancreatic cancer, which is in our current presumption law. I can tell you that through that experience working with his wife and his family, that our law is written is not a presumption law. It is, because of these provisions, end up being a tennis match for attorneys, and attorneys making money versus actually helping families. Now, you're going to hear opposition from those who create the actuary tables and some of the insurers as well, but this is the law in our books, and it's a cancer presumption law. And I think there's something fundamentally wrong with someone who meets all the criteria, who served our community, was exposed multiple times to our carcinogens, and the fire gear that we have in the fire service is cloth. It is still permeable. It's still everything that you go into with a fire gets in your skin, gets absorbed. You can't shower immediately because the fire ground, you're often there for hours on end. That's why we have the presumption law. Yet the section lines 45 through 47 really create a barrier and frankly, a back and forth between attorneys versus solving the issues and the promise that the General Assembly made to those in the public safety community who stepped up and put their lives on the line every single day. This is something that needs to go away in our code and truly be a cancer presumption law for those who step up and fight for us every single day. That's what the bill does, Mr. Chairman. This is an important issue. The constituent that I spoke to earlier, unfortunately, after walking through this process and seeing it firsthand, I really didn't realize how difficult it is to watch the family be denied after months and months. The opposing attorney meeting with their oncologist without their attorney present, finally settling only for $15,000. And then him passing away, I called the wife an hours before and finally got him qualified for line of duty death benefits so his surviving family may have a modicum of help and protection. After 8 months, unfortunately, he passed away. We were able to get him qualified for the benefits, but he was frankly hanging on over those months to have this enacted and have his family protected, Mr. Chairman.
Okay. Questions for the patron? Do you have proponents of the bill? Senator McPike, we're going to put you on the clock.
Thank you, Mr.
We're
Chairman.
starting now. Yes, ma'am.
Thank you, Mr. Chairman. My name is Virginia Diamond. I'm representing the Virginia Professional Firefighters who support this bill, as well as Senator Peake's Bill 642 and companion bills in the House patroned by Delegate Hugo and Delegate Reed. We have members of the fire departments from around the state here, and I'd like them to stand up.
Thank you. Welcome.
Thank you. As Senator McPike said, the cancer presumption is not working at all. Most recently, there was a case by the full commission which denied the presumption to an individual, Steve Weissman, who has served for 40 years as a firefighter, who had evidence from a physician from Johns Hopkins that he had been exposed to carcinogens, that those carcinogens caused his prostate cancer, and yet the commission held that he wasn't entitled to the presumption. Now, all that the presumption does is it shifts the burden of proof. It doesn't automatically grant benefits to any firefighter who contracts cancer. It simply puts the burden on the employer instead of the firefighter. This has been there for a long time. but it's not working at all the way it's been interpreted. And that's why we wanted to take those sections out of the law that impose obstacles that can't be met so that they actually don't access the presumption at all. In addition, we decided that we would like to expand the presumption slightly. We requested that 3 more cancers be added. Those are based on the science. There are so many studies, the master studies, which combine 32 different studies from all over the world that establish that when these people are engaged in fire suppression and overhaul, they are exposed to carcinogens, known carcinogens. And so while we're working on prevention as hard as we can, we also want to be able to provide them with the security and the confidence that, that their sacrifice will at least be recognized by the state. So we would like to add those cancers. There are about 20 states that have all cancers covered, including Alabama. But we didn't ask for all cancers to be included, just these 3 so that it can be monitored. And my final point is that the fiscal impact statement that's attached to the bill is grossly out of line. It's very exaggerated. For one thing, this is a rebuttable presumption, which can be rebutted. Number 2, it doesn't apply if someone has been out of the fire service for 5 years, then there's the statute of limitations bars the claim. It also doesn't apply to anyone who has less than 12 years of service. And also, as I said, it's rebutted. So in the lung cancer scenario, which is covered by a different section, employers have come in many times and rebutted the presumption if it wasn't really caused by the work. So for those reasons, we respectfully request that you support this bill. Thank you.
Thank you. 2 minutes left, Senator McLean. Yes, sir.
My name's Dave Creasy. I'm a retired fire marshal from the city of Richmond after 50 years of service in the fire service. Cancer is the greatest fear we have in the fire service today. It's overtaken heart attacks. In June of 2014, I was diagnosed with cancer. I heard those 3 words we don't want to hear, that you have cancer. I was, at that time, I had 25 tumors on my liver. I had no realization of that, no symptoms, nothing. We were able to knock back all but 2 of those, even though I was diagnosed as stage 4 and given a year to live. We were able to knock back all but 2 of those tumors. Unfortunately, there was no operation, no transplant. I was basically destined to die from this cancer. They told me it would come back, and in a few months after we knocked out those cancer cells, it did come back. It is now in my back, in my hips, and my leg, and still in my liver. We've got to bring this bill up to today's standards. The way buildings burn today is totally different than what it was even 10 years ago. I can tell you that. I've been there. And we're seeing somewhat 50,000 chemicals and carcinogens coming out of buildings today. And all you have to do is get it on your skin, and it's absorption, it's a contamination. You have to realize it's not just breathing it in. There's many ways that we get cancer. And the burning of buildings today is worse than ever. Even a Teflon pan, when you burn that, if we arrive on scene and all it is smoke and Teflon was involved, that is a carcinogen. And we are exposed to that. So I ask that you approve this bill, that you support it and bring it up and assist those. It's not going to help me. And I'm not up here for me. I'm up here for my brothers and sisters. And they need your help. I was diagnosed with the cancer in my 60s. They said I probably had it when I was in my 30s. And so it can ride around inside of us and we don't even realize it. So it's very tough on our families, and we need the support because they go through the same roller coaster ride that I go through. I've lost a lot of things I can no longer do. I'm not real stable at times. I can't work anywhere anymore because I don't have stamina. So it's a whole new world, a whole life change for you, and cancer takes over. I'm only here today because I came off my 2 chemo that I'm on right now, and that I'm able to get out the house and be here. My immune system is gone. I'm most susceptible to the flu, and that could not only be bad for me, it could kill me. So that's why I wear this mask, and I don't go out to eat. I don't go anywhere right now during this time of year. So that's what we have to deal with. Help us out a little bit for all the service that we give to the community, and it's dedicated service, I can tell you that. Thank you for the opportunity.
Thank you, sir. Senator McPike, we're 2 minutes over, so from here on out, introduce.
I'm Martha Creasy, and I'm his caregiver, and I'm here to tell you it hurts just as much to us as it does to the person.
Thank you, Martha.
Mr. Chairman, Randy Pearson on behalf of the Virginia Fire Chiefs Association, we support the bill.
Thank you.
Mr. Chairman and members of the committee, David Bailey here on behalf of the Virginia State Firefighters, predominantly volunteers, and we support the bill.
Thank you.
Mr. Chair, I'm Brooke Pittenger. I'm the Deputy Director for the Virginia Department of Fire Programs. We provide the training to Virginia's fire services. We also support this bill. Thank you.
Thank you so much. Okay, is there opposition? You're on the clock.
Mr. Chairman, if I can get somebody to hand out some copies of
Sure.
for the committee. I'm John Hurd, with here on behalf of the Virginia Self-Insurers Association, which has public and private members that are impacted by this legislation. And also Metis Holdings, Inc., which is the company that oversees the administration of all the workers' comp and liability claims against VACO's risk pool members. We pose this bill because it's going to result in public and private employers becoming monetarily responsible for numerous types of cancer that their employees develop. And that's whether or not the employment had anything to do with it. This is not what Virginia's workers' compensation system is supposed to be about. A workers' comp system is based on the grand bargain that was made over 100 years ago, whereby employees gave up their right to sue their employers in tort for work injuries in exchange for defined benefits regardless of fault. One of the major problems with this bill is that by removing the language on lines 42 through 43 and lines 45 through 47, it creates an irrebuttable presumption that cannot be overcome by the employer. And that's whether or not the employee had any contact at work with something that might have caused the cancer. For the employees of the entities listed on lines 38 through 41 who work for those employers for 12 years or more, it turns workers' compensation coverage into wage replacement, health insurance, and life insurance. And please don't forget that these same employees are also going to get Line of Duty Act benefits if they get a workers' comp award. We also have a problem with the provisions of the bill that adds colon cancer to the list of cancers, and I think you were told this adds 3 cancers. My reading of the bill, it just adds colon cancer, and then it strikes out some language. Anyway, to the list of cancers that are presumed to be work-related if the employee can satisfy their burden of proof. The scientific research used to support the addition of colon cancer is that based on a study of firefighters, not hazmat officers, not state police, and not DMV employees, although those groups of employees will also be the beneficiaries of this irrebuttable presumption if this legislation is enacted. These other groups have completely different exposures that must be studied before the science can clearly show that their employment exposes them to the same type of substances to which firefighters are exposed. That handout that was just distributed to you is a simplified version of what the results of the NIOSH study were. And also the last 2 pages contains a fiscal impact that my client with VACO's risk pool did on all the cancer presumption bills that are in front of the legislature this year. That NIOSH study points out.
Mr. Hurd, I'll remind you, you're down to 2 minutes, and there's a whole lot of people behind you.
I understand. Yes, sir. Please read the highlighted language that I've listed in that NIOSH study report because it shows what the limitations of the study are. The fiscal impact of this bill could be enormous. If you look at what I've given you, the last 2 pages, talks about what my client believes local governments
Mr.
have
Chairman.
to bear in costs.
Not cutting him off, I want to hear some others. He taking all the time. I want to hear what somebody's got to say so I can make a clear decision. He taking the whole 5 minutes. I want to hear what other people got to say.
Mr. Chairman, I will finish in just a second.
Okay.
The bottom line is, we think that this type of legislation is going to cost local governments between 25 and 33 million in additional costs per year, and the state's going to have to pay between 7 and 10 million a year. For those reasons, we'd ask that this bill be kicked up to finance and not supported. Thank you.
Thank you, Mr. Hurd. Despite what the clock says, you have 1 minute.
All right. Mr. Chairman, Chris Legault for the...
All of you have 1 minute, okay?
Mr. Chairman, Chris Legault for the Virginia Municipal League Insurance Program. We too oppose this bill for all the reasons that Mr. Hurd spoke about. And I just can't emphasize enough what a fundamental change this is to strike that language in the bill that takes away the burden of the firefighter or the hazmat officer or the state police motor carrier officer from proving any contact with a toxic substance. What does that do? It turns workers' comp into health insurance. It's never intended to be health insurance. You have to show a nexus between the employment and the condition. For those reasons, we would urge you to oppose the bill. And because of the physical impacts, if you have to send it upstairs, you have to send it upstairs.
Okay.
Thank you.
All right, less than 30 seconds.
Mr. Chairman, Joel Andrus, representing Newport News Shipbuilding. We are a member of the Virginia Self-Insured Association. For all the reasons you've heard, we oppose the bill. Thank you.
Thank you.
Mr. Chairman, Dean Lynch with the Virginia Association of Counties. We oppose the bill primarily because of the fiscal impact.
Thank you.
Mr. Chairman, Michelle Gowdy, Virginia Municipal League. You've heard all the reasons that we have. Thank you.
Thank you so much. Okay. We've heard from both sides. Senator McPike, would you like to wrap it up?
Yes, sir. Actually, it's funny. The fiscal impact from last year was, I think, $1.64 an employee. It's amazing how numbers get inflated year over year after this committee passes. Either this bill is meant to be a presumption or it's not. This is a Cancer Presumption Act. So the provisions before you, clear that up and put it exactly where it needs to be for those who put our lives on the line every single day. You've heard from direct testimony as well as the stories and some of my own firsthand experience. I think the numbers are way overinflated. This is the right thing to do. The bill before you. There are exposures. There are tens of thousands of chemicals over a 12-year period. If you're not on the job and not running a single fire, you're probably not going to be employed.
Mr. Chairman?
That is the bill, Mr. Chairman.
In order to
Senator
move
Oaks.
things along, my understanding is this needs to go to finance anyway. I would move to report and re-refer the Committee on Finance.
It's been moved and seconded that the bill be reported and re-referred to Committee on Finance. Clerk, open the rolls. Okay, Senator McBeth.
Thank you, Mr. Chairman.
15 ayes, 0 nays.
Mark, same bill?
Very similar bill, Your Honor. Mine's, Your
Honor.
Mr. Chairman, Mr. Chairman, whatever.
I'll hold you in contempt if you
yes,
say that one more time, okay?
A very similar bill, firefighter bill. Mine is Senate Bill 352.
Okay.
And I think all the parties would be the same. Is Amy Breeden still? Yes, Amy, if you would just come up. I'm not going to have you talk. If I may, very briefly, this bill, Mr. Chairman, we add some cancers to the list of presumptive illnesses, and we cut down the years from 12 to 5. I know it's going to have a tremendous financial impact, so we'd ask for the same, send it up to finance. But this really started with Victor Breeden, her husband, volunteer firefighter for 11 years. Contracted cancer, died 2 years ago. He fell just under the 12-year statutory time frame, so he never got coverage, and his cancer was not covered. But he had no family history of cancer whatsoever. And so Andrew Pullen, who is a professional firefighter and also a firefighter with the volunteer fire department at Kent Store, has been a big proponent, has brought the bill to me, and we would like to add these cancers which are on the list. The cancers we are adding are on the CDC list of top 10 cancers affecting firefighters. And the years we'd like to cut down, the 12 years is arbitrary. Victor had been working, had done it for 11 years, was not covered. So that's the gist of our bill, Mr. Chairman.
Would you like to say something? You made the trip down. You all right? Okay, thank you so much. Okay.
Mr. Chairman, I would make the same motion that we report and refer this to finance.
Okay, it's been moved and seconded that we report and we refer to Finance, Senate Bill 352. Clerk, open the rolls.
Yeah, thanks.
All right, wait a minute. Little cockpit error here. Okay. All right, close the rolls. You want to report?
15 ayes, 0 nays.
Okay, that bill's been reported and we refer to Finance. Okay, next on my list, Senator Surabel. I told you you'd have plenty of time in front of general laws to report your bills, so.
Well, I batted 500 over there, which is, at least I'm above the Mendoza line, so. Mr. Chairman, I have 3 bills here.
That was the minor leagues over there, Senator Surabel. You're in the majors now, so.
So, I don't know which one you want to handle first. You just want to take them in order?
Take them in order, 624.
Okay, 624. 624 is a bill that I'm carrying with Senator Saslaw. Oh, it is a substitute. We could get that circulated.
Okay. Do I have a motion on the amendment?
With the amendment.
Been moved, seconded that the substitute to Senate Bill 624 be adopted. All those in favor say aye. Any opposed? Okay, the substitute for Senator Surabel.
Thank you. And could I get it also? Yeah. Okay.
You've garnished a lot of interest behind you, Senator Surabel. Why don't you tell us what the
It's
bill does?
interesting. Nobody came to see me about it. Mr. Chairman, basically, this bill has to do with open-end credit plans. And as I think the committee knows, in 2009, the legislature put restrictions on payday loans. In 2010, we authorized car title loans. In 2011, we extended car title loans to out-of-state car titles. And what's happened since then is that a lot of these lenders who we placed a lot of consumer protections on their loans have started to use these open-end credit plans to evade the very same protections that we put on them. And so now you see some of the same lenders that we restricted from giving high-interest loans, making loans on these open-end credit plans at 200% interest rates. Alternatively, you see lenders that are doing the same thing with open-end credit that we prohibited on payday. For example, doing loan after loan after loan. The Poverty Law Center is here, and they can test. They have some specific cases they can cite you to of examples. But basically, all this says is if you're going to do these open-end credit loans, you have to live under the same consumer protections that we put on the others. So you cannot electronically debit the borrower's account. If you want to sue them, you have to comply with the Fair Debt Collection Practices Act. You cannot make an open-end credit loan to somebody who already has an open-end credit loan. And also, very importantly, that these protections apply to loans made over the internet. And I cannot emphasize how important that is. These internet loans in Virginia are 100% completely unregulated, 100%. My next bill we're going to cover also covers internet loans as well. But we had the Bureau of Financial Institutions convened a group of stakeholders over the last year, and I went to 3 separate meetings with the BFI and with all the stakeholders trying to come up with a system to try and deal with internet loans. I'm not sure we really came up with a consensus or not, but these internet loans have to be dealt with, and this is one of the ways we can deal with this in my next bill, or the way to deal with these internet loans, which right now are 100% completely unregulated. I don't think Virginians ought to be able to I don't think we should allow people, whether it's Indian tribes or foreign countries, to come in here and lend money to Virginians at 400% interest rates and stick them with judgments. And that's kind of a summary of the bill. I'm happy to take any questions. I know that there's some people here to testify in favor of it.
Mr. Chairman.
Yeah, Senator McDougal.
Maybe I'm missing something, but if, say, an Indian tribe out of New York State makes a loan and they put in the provisions of the loan, the venue for all litigation would be New York State, and they get a judgment in New York State, how do you prohibit that in Virginia?
Well, Jay here, he can speak to it, but there's actually been some settlements with some of these. What happens is some of these Indian tribes will use a company as a front, and then the company will actually make the loan. And if we prohibit those companies from making those loans to people inside Virginia, I think we gives our consumers and our Attorney General a means by which they can do something about it if they're doing that. And I think, and Dave Irwin from the Attorney General's office is here. He can describe some of the situations they've had to litigate involving that.
Dave, come on up.
Yes, Mr. Chairman, members of the committee, Dave Irvin with the Consumer Protection Section of the Attorney General's office. Oh, I'm sorry. I am not aware of folks being sued in other states relating to the tribal loans. We have brought some lawsuits against tribal lenders, or actually purported tribal lenders. They were not actually a tribal lender. The entity making the loans was not owned and operated by the tribe. It was owned and operated by a tribal member. Cash Call is the one that has gotten the most attention. So we're not aware of the situation that you've described. Believe that if this law passes, this will allow Virginians to be protected so that they would need to be sued here, and they obviously would be able to bring actions under the Virginia Consumer Protection Act here and defend on that basis. So I'm not aware of that particular concern having played out in practice, whether it may be, but it's just not something that we have heard about.
Questions? Okay, do we have those who wish to speak in favor? We're on the clock.
Jay Spear with the Virginia Poverty Law Center, and we do support this bill. As Senator Surville said, what we've run into is we had a client up in Hanover who borrowed $2,000, paid back $16,000 over about 3 years, and he still owed the $2,000. And that's what the open end. That's what happens when these folks use this loophole. We have another place here in Richmond called Advance Till Payday. We had a client who borrowed $100, and they were charging an $80 per month fee for that $100. And so this has become the way for former payday lenders to not follow the payday loan law. In addition, we have these online lenders that are claiming they're doing internet open-end loans so that it can also avoid our law. So we really need to close this loophole so that we can put a stop to this and have them regulated just the way we have regulated other high-cost lenders. Thank you.
Okay. Mr. Chairman, members of the committee, again, Dave Irvin. The Attorney General supports the substitute version of this bill. Open-end credit is, we believe, an outlier in our consumer finance statutes, and we've referred to it in the past as kind of exemplifying the wild, wild west of consumer lending. There's no license requirement that applies. There's no oversight by the State Corporation Commission. And most importantly, there's no limit in the law that applies on the interest rate that can be permitted. This is different from the regulation of all other kind of borrower of last resort forms of lending, whether it's payday loans, motor vehicle title loans, pawnbroker loans, consumer finance company loans up to $2,500. All of those, there's a licensing requirement, and there's also an imposition of interest rate limits. Believe that this bill, if it is adopted, would take some meaningful first steps in regulating this product. Right now, we're aware of 16 companies that are offering this product. We have sued actually 4 of those companies. 7 of the companies have operated brick and mortar. 9 of the companies have operated over the internet. That number will only continue to grow if we don't take some meaningful steps now to regulate the product. We urge you to adopt the bill. If Virginia is going to allow non-sellers to offer this product, certainly believe that the consumer protections that are provided here will provide a small step in the right direction of limiting. Addressing again Senator McDougal's question, we have not had issues with the tribal lenders in the opened-end context. That's certainly something that we may see in the future. With tribal lenders, those have tended to be closed-end installment loans that will be addressed by Senate Bill 625 and also by House Bill 1248 on the House side. So we urge you to adopt the bill. Thank you.
Thank you. Yes, sir.
Mr. Chairman, members of the committee, my name is Kevin Maurer. I'm with the Virginia Catholic Conference, and for many of the reasons already stated, we do support the bill. We'd like to close this loophole to ensure that some of the most vulnerable Virginians aren't continued to take advantage of. Thank you.
Thank you. Are there is opposed to this bill?
Mr. Chairman, members of the committee, my name is Robert Barata. I'm here today on behalf of Check into Cash, a brick and mortar lender that does open-end lending here in Virginia. We've been doing it for about a decade now. I just want to bring to your attention that this bill does very little to reduce the cost of lending, to make lending more affordable for people that need it. I'm going to talk to you about a couple of things in the bill that are particularly problematic. The first is the prescription against electronic debit authorization that's in the bill, meaning that we cannot ask people who are getting the loans to use electronic debit for that. Customers want that. It's convenient for customers. Instead, the customer will have to come back every time to the store where they got the open-end loan with cash to make the payment. This is the 21st century. Everybody uses electronic transfers, especially in the banking industry. The next thing is that it cuts down processing costs for us as well to help us keep the cost of those loans down. It also says that we are subject to the Federal Debt Collection Practices Act, which we already are. So it's a statement of fact. Putting it in the Code of Virginia isn't going to change anything. We still have to abide by that. There's a problematic provision in there that says that we cannot extend to a consumer more than one loan at a time. There's no way we know that. All we can do is ask the consumer that unless there's some kind of database that we can access. So it's impossible for us to comply with that. And then it would make any violations of the provisions of the section subject to the Virginia Consumer Protection Act with its private cause of action provisions that in effect would invite needless and costly litigation. I'd also bring to your attention a few things. One, the Consumer Financial Protection Bureau on October 4th of last year promulgated a 1,690-page rule package on payday, vehicle title, and certain high-cost installment loans. Those rules have not yet taken effect and could affect lending in Virginia. And over the past summer, the Bureau of Financial Institutions hosted a work group on consumer finance lending that included open-end installment lending. Any kind of consensus that came out of that is reflected in a bill in the other body that Delegate Kilgore is carrying. And then finally, I would want to emphasize that nothing in SB 624 would help it make it any easier or cheaper to extend open-end loans to consumers who may need them. One could argue would have the opposite effect. For these reasons, I urge you not to look favorably on the legislation. Thank you.
Mr. Chairman, Morgan Guthridge representing Community Choice Financial. We operate First Virginia Loans. We have 25 stores in Central and Eastern Virginia. We've been in business for about 25 years. We employ 153 Virginians. We offer a variety of financial products ranging from prepaid debit cards, Western Union services, money orders, tax preparation services, and lines of credit. The line of credit product is the only one that we offer out of our stores. I would just note that if you take out a line of credit with us and you pay it back within 30 days, there's zero interest charged, and 25% of our customers fall into this area. In the interest of time, I'll just associate myself with Mr. Barata's comments as far as the bill and would ask that you all would oppose Senate Bill 624. Thank you.
Okay. Yeah, Senator Sproul.
Yes, the gentleman who just left.
Mr. Guthridge.
Thank you, Mr. Chairman, thank you. So if I get a loan, so if I pay it back 30 days, no interest.
Yes, sir.
Now, what is your interest rate on the average? So I'm not gonna pay it back in 30 days. I'm aboard 6 months or what have you. What are your interest rate?
Mr. Chairman, Senator Sproul, it varies on the amount borrowed, but generally our rates run from 18 to 20 to 22%. The more you borrow, the lower the interest rate will be. On an annualized basis, it comes out to about 150 to 264% on an annualized basis.
Mr. Chairman?
Yes, Senator Sproul.
So, if a long-term loan, so if I would have to borrow $4,000, and a long-term loan, so you're saying that I know if I get a loan from a bank, I know what my interest rates can be every month. So are you saying on a long-term loan, it could be up to 100%? On a long-term loan? What is your interest rate if I bought for 3 years, 3 or 4 years, on a loan that you give me for 3 or 4 years? What is the interest rate over that long period of time?
I'm not sure I understand the question.
I'm bought $3,000 from your bank,
Right.
and I can't pay it back in 6 months, but you make an agreement for me to pay it back in 2 years.
Mr. Chairman, we work with all our customers to try to set up a time
Yes,
in
sir.
order to pay it back.
Mr. Chairman, I understand that you work up a time. You can work out a time with me because I can't pay a lump sum. You can work out a time with me to pay it back in 2 years.
Yes,
okay?
sir. And we also, Mr. Chairman.
Wait a minute. No, I'm telling you my question. So now you're saying, well, because of my financial situation, you can work it out with me for 2 years. Now my question is that, so in 2 years, so what are my interest rates going to be for the 2 years? That's my question. For 2 years, I'm paying your money back. So, sir, what are my interest rate back for that money for 2 years? What is the interest rate would be finally when I pay it off? The interest rate on the loan.
For a $4,000 loan, you're looking at likely an 18% rate per month that you go over the 30 days.
I'm not going to go over. I'm sorry, Mr. Chairman. I'm not going to go over. I'm paying on on time every month. I'm not going to go over. For 2 years, I'm going to pay on time every month. So after 2 years, would it go over 18%?
Well, if you, Mr. Chairman, Senator Sproul, if you are paying on time,
yes, sir,
then you will not be charged interest if you keep making your 30-day repayments on the loan.
Mr. Chairman?
Senator McHugh.
If I understand, these are short-term loans. These are not long-term. So the terms of the loan are 30 days. So it's not a 2-year loan. That's not a term option that you can really get, if I understand.
Thank you.
Okay.
Thank you.
Senator Sproul.
Then in that case, unless Senator Serbia was not telling the truth, I'm not going to say, because unless he's mislead me, is it true that he was saying that people pay 100% loan on the short-term loan, they pay up to 100% interest rate on the short-term loan? Are you aware of that case, that they're paying over 36% interest rate on a loan, a short-term loan?
Mr. Chairman, Senator Sproul, I've certainly heard instances to that point. That's certainly not a practice of our company. Again, if you can pay back within the 30 days, then there is no interest. Depending on the amount borrowed, that would have a bearing on what the monthly interest rate would be. We certainly try to work with our borrowers to pay it down as fast as possible. We also offer a rapid payment plan where we pay down the principal and work with them so that they don't get too far off with the loan
Thank
and
you, Mr.
accrue
Chairman.
Uh,
too much interest.
Thank you, Mr.
Thank you,
Chairman.
Senator.
I
Are
have
there
a-
others? I'm
I
sorry.
I have a question for the
Yeah.
gentleman who spoke before you. Yeah. Sir, how you doing? You raised a question that if I borrow a loan from you, and you said that you have no way of telling that I want a second loan, you have no way of telling if I come in and borrow a second loan. I think when I go to my bank and I bought a loan from my bank, and when I go again, have not finished paying it off yet. now go again to borrow money, they can go in a computer somewhere and say, hey, wait a minute, you got a loan already. So, but I heard you said that you have no way of telling that if a person is getting a second loan. Did I misunderstand you on that?
Yeah, Mr. Chairman, no, you did not misunderstand me. What it says in the proposed bill is that we cannot offer a loan to someone that would then make them have 2 installment loans. I was saying that the only way I know that someone would have an installment loan is if they were trying to get it from me.
So
I don't know if they've gone down the street to somebody else and took one out, unless there's some kind of database that we can access. That's what I was getting at there.
Last question then, is there any evidence, Senator Serville, he's an honest person, is there any evidence that he was saying that some, not your company, but some companies do charge astronomical interest rate on a small loan?
Mr. Chairman, Senator Spruill, I have read that the Attorney General has prosecuted certain companies for such a thing. That is not the practice of our company. We try to work with people when they get into trouble and try to get them out of trouble. But there are those out there, as you know.
I believe you. You're an honest man. Thank you so much.
Thank you.
Very good. Any other questions by the committee? Senator Serville, why don't you finish up and let's go.
Mr. Chairman, I do have a question.
I'm sorry, Senator Black.
The one point that was just raised about the lender not knowing whether there is a loan with a separate company, I wonder if it would be possible, and I don't know, I don't have it in front of my battery just gave out on the computer, but I wonder, would it be harmful to put something in there that would limit it to only one loan with a particular company?
I don't think so, but I will tell the senator that the language in this bill was taken straight out of the existing car title bill and the statute and the existing payday loan statute, which is something those other lenders are already having to live under.
I see.
So I don't believe anybody's come and said to us that it's not workable the way it currently exists for them, and they haven't, I don't think, have had a problem with it, or if they have, maybe they got sued, but they've been here to ask us to change it.
Okay, thank you.
Good. Mr. Chairman, if I could finish.
Sure, absolutely,
Okay.
wrap up.
So, first of all, I appreciate Mr. Guthridge coming to me, and I'd had a chance to talk to him about his concerns. Mr. Barada, I found out today at the podium. Perhaps if we had talked, I could have corrected him on some of the things he said, which were just flat out incorrect. First of all, with regard to these provisions about electronic debiting, car title lenders and payday lenders are not allowed to electronically debit today. And that's been the law in this state since 2009 and 2010. If they were having problems with not having electronic debiting, I would have thought Title Max, Loan Max, payday lenders, Reggie Jones and his people would have been in here and asked us to fix it. They seem to be using it. It seems to be working fine. Doesn't seem to be a problem. Number two, the Fair Debt Collection Practices Act. The reason that this language is in about the Fair Debt Collection Practices Act, making it applicable to them, is because it currently doesn't apply. The Fair Debt Collection Practices Act is a federal law, and it only applies when a third party goes to collect somebody's debt. But if you go to collect your own debt, the FDCPA does not kick in. So if these open-end lenders want to use harassing tactics, they want to keep calling you even though you have a lawyer, they want to call your employer, they want to try and publicly embarrass you, they're allowed to do all those things because we don't have similar protections for our Virginians that we give to car title loans and for payday. So, what we have here is we set up a system in 09 and 10 for these lenders, and instead of following our laws, they just went out and now they're using these open-end credit products to evade the laws we passed. And if our laws are going to have teeth, we can't keep playing whack-a-mole. We need to keep them within the protections we've adopted. And as to the senator from Chesapeake question, you heard Mr. Guthridge, for their short-term loans, for their small short-term loans, people are paying 200+% interest because it's 18% per month. And when you add that up on an annual basis, it goes over 200%. So, we met 3 times with the BFI in their office. Mr. Face is here. Delegate Kilgore's bill is a vague attempt at consensus, but there was not a full consensus in that room. We met 3 times, and this and the next bill you're going to see, I think, are the best solution, I think, to deal with the problem. So I would hope the committee would act favorably on it. Again, Senator Saslow, who's upstairs at the Northern Virginia delegation meeting, is co-sponsoring with me, and along with Senator Black, which I appreciate. So hope the committee would act favorably.
Okay. Any other people? Any other questions? Okay, the committee operates by motion. It's been moved and seconded that Senate Bill 624 be reported. Any discussion? Clerk, open the roll. No, Cosgrove is not voting. No, he's not voting. Okay, clerk, close the roll.
5 ayes, 8 nays.
Okay. Reverse the vote for pass by indefinitely. Okay. Senator Servo, you got another one.
Great. The next one has.
Excuse me, Mr. Chairman.
Yeah.
I know we're
Senator
different,
Sproul.
but this air conditioner is getting me sick. The air conditioner, I'm catching a cold from that cold air coming here.
Can someone in the clerk's office look at, turn it down to air conditioning?
I know I'm different, but even white people saying it's cold in here.
There's that one, and this next. They both.
We'll work on getting the air conditioner turned down. Senator Servo.
Thank you, Mr. Chairman. I think there's a substitute on this one, too.
All right. Is there a motion on a substitute? Been moved and seconded that the substitute be adopted. All those in favor say aye. Any opposed? Okay, the substitute's before us. Senator Servo.
Thank you, Mr. Chairman. We need to pile those up here, too, as well. So this has to do with consumer finance lenders. The Consumer Finance Act, and Mr. Smith knows this better than I do, I think dates back to 1919. Is that right? 1919. And it hasn't changed much since then. And the existing consumer finance loan system has a rate cap. Has a rate cap for loans that are under $2,500. They're limited at 36%. Loans that are over $2,500 have no interest rate limit. And what has happened is that a lot of companies, including some of these companies, again, over the internet, have taken our existing system in Virginia, which has worked well for 98 years, and have started to use it to make loans to people at, again, 200%, 300%, 400% interest. Formerly in title lender stores, but Mr. Chairman, you sent a letter which shut that down. But now they continue to make some of these loans over the internet. And so what this bill does is it basically says that any licensed consumer finance company, again, a licensed consumer finance company, if the loan is made, it has to be at a 36% interest rate, and it has limitations on the term of the loan of 6 to 120 months, and it again prevents these lenders from doing these back-to-back loans that we've had before, or that payday lenders used to do, that they were allowed to do under this. And the Poverty Law Center can tell you, we've seen some companies in the state using these provisions to make loans at 950% interest rates, documented examples. And again, the Poverty Law Center can explain them to you. This would shut it down. And Mr. Smith's group is supportive of it. Oh, he's right behind me, and he has a lot to say. He's very anxious to talk, so I'm going to turn it over to him.
Well, he's right behind you. You're on the clock, 5 minutes.
Gotcha. Thank you, Mr.
Proponents.
Chairman. Jeff Smith, representing Virginia Financial Services Association. It's the statewide business trade group that's celebrating its 100th year in Virginia. They started in 1918, and I've represented them for the past 41 years. It's the old household finance, beneficial finance. It's an entirely different business model than what you've listened to previously. It's an installment fixed-rate loan. We do not make loans duplicative of other companies because we underwrite them. We do credit checks. We do employment verification. So we know the customer has more than one loan or not, irrespective of where it was. What's happened in 2000, Senator Norman introduced legislation for us to deregulate the interest rate only on loans above $2,500. And what's happened is everything that you've heard previously are other lenders creeping back over into the Consumer Finance Act, which was never contemplated in the beginning, and second of all, never contemplated in the business model for the past 100 years that we have in this state. It's a fixed rate installment loan. It helps people purchase appliances, SUVs, RVs, personal loan consolidation at a fixed, affordable monthly payment. And when a customer finishes their fixed rate monthly payment, their credit score goes up because we do the credit check and report it. Second of all, these customers repeat. They come back time after time as a safe harbor, affordable lending practice. The study that's been referred to at the Bureau of Banking is going to present legislation to you shortly about internet lenders being able to operate under this act. So all of a sudden, in the last 5, 6, 7, 8 years, we've got title lenders, payday lenders, revolving lenders, and now internet lenders jumping the fence and coming over into the Consumer Finance Act that had never contemplated this type of lending. So not only do we support this legislation, we drafted it because we want the old, prior to 2000, principal regulations back in place so that the members that have invested this kind of money, significant money, in brick and mortar facilities, hired people, and have made these loans available, they'll get the old predictability and some certainty to protect these loans to continue on for maybe the next 100 years. And we would hope that you, since the industry is asking for this support, we would hope that you would acknowledge it and understand the differences and why this is important to protect the consumer in this practice, because otherwise there won't be these consumer protections. I'll be glad to answer any questions, Mr. Chairman.
Yeah, Senator Chafin.
Thank you, Mr. Chairman. A question. What minimum FICA or Beacon score, what's the minimum that you'll consider a loan at?
I represent the industry,
okay,
and the Virginia Financial Services Association has many members and many branches and many different credit standards. I would suggest that the fact that the rates for a small loan would be like 36%, and the larger the loan, the rate goes down to 12 or 14% annually, not monthly. And so therefore, the FICA scores kind of drift with the risk of the loan and the interest rate. I can't say specifically that we cut off at 20, 30, 200, 300, whatever. I don't know.
Senator Chafin.
But would it be fair, sir, not to, or to say that there are people that you're going to consider uncreditworthy? You're going to turn loans down.
There is no question about that, and that's where all these other lenders serve a purpose. There's no question, because it's a different model, a different business model. And we do have those same standards that fit our business model. And when they don't, that's how and why title lending and all of the others surfaced, and it was nothing more than to fill a vacuum that we were leaving.
Other questions? Okay, back on the clock. You got a minute and a half left.
Mr. Chairman, members of the committee, Dave Urban again with the Attorney General's office. The Attorney General supports this bill as well. We see that there are two significant positives if it's adopted. First, the bill is going to close a significant loophole in our consumer finance laws by extending the 36% interest rate cap to loans above $2,500. Right now, we have that cap on loans below $2,500, but there is no cap on the loans above $2,500. The fact that there is no cap was exploited for several years by motor vehicle title licensees that held a dual license. They were making triple-digit interest rates on long-term loans that were secured by the title. Second, and we believe this is significant, the bill will encourage consumer finance licensees to make smaller loans and to offer loans of $500, $1,000, $1,500. This is something that they're not doing now. They have told us for years, and we understand that there is a cost of underwriting where the cost of underwriting may be just as high for a small loan as it is for a larger loan. This will allow them to charge a processing fee to recoup some of those costs. We believe the bill will provide reasonable access to credit and more access to credit for that reason, and we urge you to adopt the bill. Thank you.
Okay. 2 seconds. One.
Jay Spear with the Virginia Poverty Law Center, and we support the bill. It's pro-consumer and it's pro-business, pro-good, responsible lending business.
Thank you, Jay. Yes, sir.
Mr. Chairman, Kevin Maurer, Virginia Catholic Conference. We also support. Thank you.
Thank you so much. All righty. Is there opposition to the bill? Yes, sir.
Mr. Chairman, members of the committee, my name is Derek Hine. I'm representing the Online Lenders Alliance. As has been mentioned previously by a couple members or a couple testifiers, we're in favor of what came out of the stakeholder meeting this summer and this fall. And I understand that is over in the House and this is the Senate, but we're supportive of, we felt like as the Online Lenders Alliance that we made a good faith effort during that process, and that's what we're supporting right now. I understand that you all have another issue before you right now, but we're going to support what was in that, came out of that compromise effort. That's.
All right, thank you.
Yep.
Does anyone else wish to speak against the bill?
Move to report, Mr. Chairman.
It's been moved and seconded that the amendment nature substitute be reported. Clerk, open the rolls. Okay, close the rolls.
12 ayes, 2 nays.
All right, you're batting 500 so far.
Excellent. Let's see if I can lead the major leagues here. So the last one, what's the number on the last one, Mr. Chairman? 629. Okay, 629 is a bill you all saw last year, but you PBI'd it because there was a lawsuit pending, and in full disclosure, I was the attorney in that lawsuit, which is why the BFI asked me to carry this bill, because I know something about this. So this is a bill that the BFI requested both last year and this year to clarify existing law. Right now, car title lenders are required to file a report annually with the Bureau of Financial Institutions setting forth certain activity. And the BFI basically takes all those reports and then they aggregate them and put out one report which summarizes all the activity. So it summarizes the total amount, total loans made, total number of loans made, the total value of outstanding, the total number of defaults, a whole bunch of statistical data. This bill basically just says that instead of producing that summary report that has all the data in it, they have to produce to the public, if requested, the reports filed by each lender separately. The BFI, when they looked at their original code section, they thought that's what the code section said, but the State Corporation Commission was concerned about applying it retroactively. So they were concerned that producing, for example, Title Max, Loan Max, et cetera's reports that they didn't know were going to be public wouldn't be fair, and so they only wanted to apply it going forward. This statute basically just codifies what the SEC wanted to do, to make the code clear so we don't have the dispute anymore. And again, the bill is requested by the BFI, who I think is here to testify in favor of it.
Okay, let's hear from the questions for the patron. Does anyone wish to speak in favor of the bill? Hey, Mr. Face, good to see you.
Yes, sir, Mr. Chairman. Joe Face, Commissioner of Financial Institutions. We did request that the bill be put in by Senator Sorville. You may remember this bill from last year. It was before you, but it was passed by, given that there was a Supreme Court case. That case was decided, and we brought the bill back
Okay,
again this year.
thanks, Joe. All right, is there anyone else wish to speak in favor of the bill? Is there, in favor? Not in favor, okay. All right, let's take the opposition. You're on the clock.
Thank you, Mr. Chairman. David Halleck on behalf of Loan Max. This is a situation that you heard it last year and PBI'd the bill. The Supreme Court ruled in our favor at the case, and so this bill is trying to reverse in large part what the Supreme Court of Virginia decided on the case. Part of the issue here is if you've looked at the State Corporation Commission's website, as Senator Serval said, they publish annually a report on all the actions, has a lot of detailed information in it, the number of loans, the amount of loans, the average amount of loans, the time duration, just a ton of statistical information that's available to the public about these loans. What our concern is if you then take that information we're providing as a regulated entity, a number of these businesses provide annually to the State Corporation Commission so that the State Corporation Commission and Commissioner Face and his team can do their job in regulating. But a lot of these companies are privately held businesses, and so you're saying that what this bill would do is say the proprietary business information that we provide to the commission so that they can do their regulatory job would now be made public, and would put these companies at a particular business disadvantage. We know about different companies in a competitive environment, what they are doing. We feel that the information that's provided annually, and again, you can go to the commission's website, look at all this detailed information about the industry as a whole, is what's information that's accurately available to the public and to you all as policymakers to be able to determine the proper policies going forward without going into making public every company's private, confidential, proprietary information. So we'd ask for you to reject the bill.
Thank you. Any others that wish to speak in opposition? Seeing none, you want to wrap up?
Yeah. So there's nothing special about this information that's being produced. The total amount of loans, the total dollar value made every year, nothing special about that. The total number of loans, the default rate, whether or not there's an enforcement action being taken against them in another state, the average interest rate, the average length of time before a loan defaults, how many repossessions they had to do. These are not proprietary statistics. They're all reported to their regulator. Not even the Attorney General can even look at this. So for example, if one of these lenders has a default rate which is 3 times the default rate of another lender, that's kind of an important data point in terms of whether or not maybe somebody's following the law or making the right kinds and long kinds of loans. And this information really should be, I don't see any reason why this information shouldn't be publicly available. The BFI, when they filed their initial brief in the case last year, said they thought that the existing law said that these individual reports should be produced. I think it was our intent. If you actually read the statute, I didn't think it was necessary when I was litigating the case, but the SEC disagreed with me and the Supreme Court affirmed them. So I guess my legal opinion's not always accurate, but in any event, yeah, it's
on tape.
We're on the record. But in any event, Mr. Chairman, I think the public, when people are making these kinds of loans and selling these kinds of products, and when 1 out of 3 people default within the first 6 months, I think that kind of information ought to be available to the public, and we ought to be able to see on a lender-by-lender basis how they're doing. These are very risky products, and the public has, I think, and the Attorney General too, ought to be able to know about it.
Okay.
Mr. Chairman.
Questions?
Yes.
Senator Chapin.
No, it's not the nature of a question, but it is a statement that I wish to make. I don't support the bill. I have the highest regard for Mr. Face and the Bureau, but I didn't support Senate Bill 625 either, the passed bill. I mean, I think the reality that's in the room, and we all have to understand it, is there are people that are not creditworthy, okay? They're not creditworthy for regulated institutions. They still need credit, and the issue is, would you prefer that they go to Mac the Knife or to Rocky and get that credit, or would you prefer that they go with a licensed business, whether it's on the internet or some other means? There are people that simply can't they're not creditworthy, and it's an unfortunate truth, okay? It is an unfortunate truth, but it is the reality, so I'm not able to support the bill.
Okay, we've heard both sides, and the committee operates by motion.
Move to approval.
Been
Support.
moved. I don't hear a second. Is there another motion?
Pass bill by.
Okay, it's been moved and seconded the bill be passed by indefinitely. Clerk, open the rolls. Okay. Close the rolls.
12 ayes, 1 nay.
333 in the major leagues. That's pretty good batting average for
batting
anybody.
title, yeah.
Thank you, Senator Servo. Senator Deeds, you've been very patient. So I know the hour's late, but you've been there, and we're going to respect it.
I've got two bills, and I don't think they're going to take as much time, though they might present some difficult
I
subjects.
have three on the docket, so
671, we rolled into Senator Donovan's bill earlier.
you got that one right. Okay.
Okay, so 672 addresses basically the same thing, and you'll recall, in Charlottesville, Albemarle, we've got a significant problem because those people have to buy on the exchange. There's only one provider, and so the 672 takes a little different approach from 671. It allows self-employed individuals or single-member LLCs to participate in the small business market. Most of these people facing these high premiums are successful self-employed business people. They don't qualify for subsidies, but they can't afford to spend tens of thousands of dollars a year on health insurance. Their choice is simply just to get out of the market, and that's not good for anybody. So 672 just amends the definition of small business to it's a small employer for purposes of health insurance to provide that it includes a self-employed person.
Okay.
I do have the same.
Come on up. Briefly, as you know.
I'm not quite as nervous this time. So that sounds like an awesome bill to me. I have a small business, actually. Not employed, but my business partner is my husband for 14 years, but he would not qualify as an employee because we are married and we file the same taxes together. I do have one employee, Marcos, so I was able to leave the ACA and file a small group. I am now a small group policyholder with my employee Marcos. My premium is back down to $550 a month. As you may recall, at the ACA for an individual plan who does not qualify for a subsidy, it was going to be $1,869 a month. Of course, as you know, plans are not always apples to apples. This plan for $550 a month for a small group is $6,000 deductible, $6,000 out of pocket, but it's a PPO plan, so I have much greater access to physicians, which is very important to me. I'd also like to point out that we were told by Optima, who again is the only insurance company available in the Charlottesville area, that the reimbursement rates were the same for an individual plan as they are for a small group plan. So I don't understand the difference. So this is my story, but as I mentioned before, there are so many stories. There are so many self-employed people in Charlottesville, and I'm sure all over the state of Virginia. If we could qualify for small business insurance, for some reason those plans are substantially cheaper than an individual on the ACA market, it would help us so much. And the thing about this plan is that if this plan were to pass, it would give relief for us this year, which is imperative. I mean, people cannot continue to afford $36,000 for an insurance premium for a really inferior piece of insurance.
Thank you so much for coming down here, and thank you for
Thank you so
sitting
much
through the
for-
meeting. Now, we truly
Thank you.
appreciate it. Is anyone opposed to this bill?
Mr. Chairman, I'm Doug Gray, Executive Director of the Virginia Association of Health Plans. In essence, what this bill says is that one person is actually two. The definition in the federal law of a small group says one and an employee, So you have to have two to be a small group. What this is saying is that one person can be a group. So what that's going to do is basically make the individual market even worse. So you take more and more individuals out and you put them over here into the small group market. And so that's why states haven't done it, is because in essence it makes the small group, the individual market even worse off than it was before. Is it better off for the person who can get out of the individual market and go over here in the small group? It might be. But overall policy impact, you're going to make the individual market worse.
Mr. Chairman.
So that's what it does.
Senator McDougal.
How is the individual market where somebody's paying 25 to 30,000 even a choice? I mean, we talk, all I hear out there is about Medicaid expansion, but the reality is there are thousands of people who are working, trying to do the right thing, and it's better for them to pocket that 30,000 and negotiate with the hospital than give it to y'all. Mr. Chairman, if we give people an option that have businesses and are trying, that's the right direction to go.
There was a
Well
question.
said, Senator McDougal. Okay, are there any other questions? Okay, we've heard from each side.
The bottom line is there are other areas of the law where one person is.
Senator Deeds, you're on a roll. Okay. All right, committee operates by motion. It's been moved and seconded that the Senate Bill 672 be reported. Clerk, open the rolls. Oh, hang on a minute. Let me do my thing here. Close the roll.
14 ayes, 0 nays.
I had a feeling, Senator Deeds.
Well,
Okay.
Thank you, Mr. Chair. Your instinct's better than mine.
One more.
887 is what might be referred to as a junior firefighter bill. Virginia's fire services are comprised of more than 65% volunteer firefighters. Statistics show that while fire and rescue are seeing increased volume for calls and demand, the number of volunteers is decreasing. Many departments have started Explorer or junior member programs to encourage teenagers to develop an interest in emergency services. These programs engage youth in non-operational roles and can have significant impacts for the future of many of these volunteer fire departments. Current law permits youth to participate in all activities of a fire department provided they have attained certification. This bill clarifies that youth may participate in non-hazardous activities such as training courses without having achieved certification. The bill also directs the Fire Services Board to adopt a junior member policy to provide guidance to our local fire and rescue departments. The administration supports the bill. Someone here from the Department of Fire Services is available to testify. It's my understanding there's not any opposition, and I think Brooke has been around to most of your offices to talk
Okay,
about the bill.
come on up real brief.
Brooke Pittenger, Deputy Director for the Department of Fire Programs. We're the agency that provides this training. We support this bill. If there was a we love this bill option, we would definitely check that as well, and we appreciate the senators' work on this.
We ought to put it on the standards of achievement. That way there's another way for school systems to get it. Mr. Bailey.
Mr. Chairman, members of the committee, David Bailey here on behalf of the Virginia State Firefighters who fully supports this bill. It should be a part of that standards of achievement. It will help ones who are able to take courses. I have a 16-year-old in our family who wanted to be a junior firefighter. Now, if this passes, she'll be able to take courses, not just do other things. So it's a very helpful bill.
All right, is there anyone opposed to this legislation? Been moved and seconded that Senate Bill 887 be reported. Clerk, open the rolls. Okay. Close the rolls.
13 ayes, 0 nays.
All right, at this point, I want to make it, I know some of you all have been here a long time and may be waiting. There's one last bill from Senator Wexton. That would be Senate Bill 948. She's asked that it be stricken from the calendar. So moved. Been moved and seconded that Senate Bill 948 be stricken. Clerk, open the rolls.
Mr. Chairman,
Senator Sproul.
I don't mean to be a pain, but it's cold in here. I mean,
All right, you're gonna love my next announcement, Senator Sproul. I've been very attentive. Wait a minute, let me get. All right, have I got everybody covered here? Okay, that bill's been stricken from the.
13 ayes, 0 nays.
Okay, listen, the rest of the bills on the calendar are all members of the committee. They'll all be back for our next committee meeting, and eventually we'll be here till 9 o'clock. I can see that coming, but it's not going to be tonight, so the committee will rise because Senator Spruill is cold.